broadcasting live 4 days a week worldwide
from the sunny beaches of Southern California.
This is ExtremeHealthRadio.com.
Hi, this is Reed Davis from FunctionalDiagnosticNutrition.com. Really pleased that you're listening to Justin and Kate from Extreme Health Radio.
Like a little dance party in the studio here.
It's a good show when you have your guests dancing before we even start.
I know.
Good day.
Kate, I thought you were going to join in there.
I have been known. Next commercial.
Next commercial break. Well, we're excited to be here today. We have Lisa Kalison in the studio. We're going to be talking about mammograms and breast cancer and thermograms and whether or not mammograms should be the way to go or thermograms. I'm sure she's got some ideas about that. Mm-hmm. So we're going to talk all about this today. So if you'd like to join us, we broadcast live on Friday mornings at 9 a.m. Pacific time at extremehealthradio.com/live if you'd like to join the chat room and make some friends, ask some questions, and have a good time.
Right on. Right? Party in the chat.
Sounds good to me.
Party in the chat room. And if you guys would like to support our show, we just set up a brand new website, or what do you want to call it?
We're going to call it a
service?
Tool.
A tool?
A service, yeah.
It's called Patreon. And it's really cool. If you guys would like to support us on a per podcast basis, you can do that. You can even donate 25 cents, 50 cents per podcast.
Doesn't sound like much, but if everyone were to do it, it actually keeps stuff really rolling over here.
Yes.
And we value anything and appreciate even a quarter.
Amazing. So that's at extremehealthradio.com/support, and you'll see a picture of Kate's mug on the right side of our website.
Gotta love that.
Gotta love that. And you can watch our video on there. And today we have Lisa Kalison on, and we originally got introduced to you via Dr. Bergman. I believe that's
Dr.
how
John Bergman at Bergman Family Chiropractic.
And you're on your way up there just after this.
To do our imaging, yes.
Do you go up,
one of our hosting clinics.
Do you go up there every week or on a regular basis?
First and third Friday of every month.
Mm-hmm. Wow. Okay. Yeah. This is awesome. So people go there and get screenings, a thermography session with you. And how long does that normally take?
Well, the way that thermography works is very different than most other screening. There's actually a cool down period. So, it could take, and it depends on how many body parts you want imaged. So we can do just the breast. And the first screening will take about an hour. We could do what's called the women's health screen or men's health screen, which is the entire trunk, head, and neck. Okay. And that gets all the most important indicators that thermography can see, being that it's the organ structure and where we see windows into what the immune system wants us to know. And then there's the full body. And
full body.
The health screens can take about an hour and 15 to an hour and a half. Full body can take about an hour and a half to an hour and 45 minutes.
Interesting. Wow. And so how many people can you see in a day when you go up there to Dr. Bergman's?
It depends on which level, how many body parts. So if we have all full bodies, maybe 5 or 6, and we could go anywhere from 8 in the morning to late at night.
Wow.
So,
oh my gosh.
This
is gaining popularity, I'm sure. People are becoming more aware of what it is.
Absolutely. Yeah.
I remember being at Dr. Bergman's. We went to a talk at the Living Temple months and months ago, probably close to a year ago, and he had talked about thermal. Can you also call it thermal imaging?
That's actually the more common
You call that more?
Thermal imaging is the imaging, when people are referring to it as an imaging technique.
Okay.
Thermography is kind of the technical term, and thermology is the scientific term.
Okay.
So where you think of X-ray and radiation, a radiologist interprets the images. In thermology, a thermologist interprets the images. So they're the equivalent to a radiologist.
So can I go ahead and ask how in the world this found you, or you found it?
Yeah,
I'm
curious. I found it.
A long time.
I was born at a very young age. in Chicago.
That tends to happen.
Darn, I had that too.
And I grew up on the typical hot dogs, hamburgers, pizza, Hostess by the box. We were basically amazing sugarholics.
Wow.
My dad had a really bad sugar tooth.
Really?
And we couldn't eat strawberries without dipping them in white sugar.
Wow.
So, and we're all amazingly fit and thin and had incredible energy. And I never gave any thought to whether we were healthy or not. We just seemed healthy, and we didn't question the food that we were eating. You know, we wouldn't think that anyone would like mess with our food. Why would they sell us something that's not nourishing?
I know, right?
Right?
Isn't that amazing how many people think that way, even still today?
Yeah, absolutely. They just trust blindly that the food is being regulated, and there's can't be anything harmful in it. And
they would
of course
never
it's
harm us,
nourishing.
would they?
Right?
They wouldn't sell that.
Yeah.
No,
So
they wouldn't do it.
I was inspired to move to Los Angeles when I was 20. And so I say, people ask me, where did you grow up? And I always, Kate asked me that when I got here this morning. Well, I spent my childhood in Chicago, but I grew up in LA, and I spent, from age 20 to 30 there. Anyway, I was introduced to health consciousness, if you will, when I was about 21. With my first boyfriend there in LA, and he had gotten into a car accident and had to have a bone graft. And he was very fortunate to be matched up with a surgeon who did the bone graft, who was a football surgeon, and it was groundbreaking, something that made the medical books, medical journals, and history, and never been done before. But they told him he could possibly limp the rest of his life. And he, growing up in LA in the health land of fruits and nuts, as they say,
all the
the health
Right.
capital. He had the wherewithal and the experience to say, well, is there anything I can do to assure a better healing process and possibility of not limping? And the bone surgeon, the football surgeon said, I'm going to introduce you to a chiropractor who is going to have you do an intestinal detox and juicing every day. And you're going to get all the toxins out so you can get the nutrients in, fortify the immune system, take the toxic burden off of the immune system. This was in 1977, 78.
Who was this doctor?
I don't even, I wish I knew his name, because I certainly would like to give him some credit and thank him for setting me on the path.
At the time, already sort of knowing this stuff, and the doctor confirmed it?
He was kind of semi-healthy, health conscious.
Wow.
And I said, I was standing there, witness, and I said, this sounds like a good idea. It's probably best for us to do this together. It sounds pretty involved. And we embarked on this, and I had no idea what I was getting into.
Wow.
And it was a 4-week intensive. We're juicing every day. The first week we're doing psyllium and bentonite clay and all these roto-rooter earth elements that pull plaque out of your intestines.
Yeah.
And in the first week, and I mind you, I was only 126 pounds. In the first week, I lost 9 pounds.
Whoa.
I had no fat to lose. It was all intestinal plaque. Don't mean to gross you out, but it was literally like tar, you guys. And that's what it took, and that's what hit me. The light went on, and I thought, gosh, if I can do this much damage in the first 21 years of my life, I better stop now. And that's literally what changed my trajectory in life.
Wow.
Was doing an intestinal detox, and everything changed. And you know what's really cool about it? When you get all the toxins out of your system, you get all the bad critters out of your system. You get the candida and the parasites and the amoebas and viruses, all that stuff cleared out of your system. So the cravings aren't there for all the sugar and the processed food and everything. And what's interesting too is that before this, I had what I thought was unlimited energy, bounce off the walls kind of energy. But what I realized is that was young, adrenal-driven energy.
Yeah, it's different.
When I was done with this cleanse, we went completely raw and completely organic and vegan.
Oh my gosh.
And I had more energy than I'd ever had. And what was really phenomenal about it is that I had a mental clarity, an emotional clarity, a physical lightness and energy I'd never had before, because I think for the first time in my life, I was getting my energy from my food.
It was different.
In 21 years, it was the first time I was getting my energy from my food.
Isn't that amazing?
And it blew
how
me
much
away, changed my trajectory completely.
All this junk you had in your body at 21 years old, from the sugar, processed food. I mean,
Cheerios every morning, when you're done eating the Cheerios, there's a mound of white sugar and still in the bottom of the bowl. I mean, just crazy things that we ate.
Did this
the
involve
grilled cheese
doing
sandwiches and
colonics
PJs.
or anything like that as well?
No, well, we did enemas every morning.
Enemas, yeah.
Coffee enema in the morning, tea enema at night. So just like everyone else, we were having our coffee in the morning.
Yeah. A little different.
Well, I remember the coffee enema instructions. It said at the bottom, and this is the only end you should ever put coffee into.
Yeah.
We've read that as well. We get a good laugh. It's true.
So that changes the pH and gets the liver to produce more bile to get the toxins out of all the nooks and crannies. So very powerful. And just, I have to say, within about the first 5 or 6 days, I felt like I was walking 3 feet off the ground. It was just incredible.
So the question is,
so
how
that
was
got
your
me on my
boyfriend?
health path.
How was your boyfriend?
Oh, he never limped. Completely healed.
Whoa.
Completely
Oh, my
healed.
gosh.
Never, no limp.
That's awesome.
So it just tells you how important, and this should be the first order of business in any health issue, is taking the toxic burden off of the immune system, because everything's about root cause. You've got to get to the root cause, and it's almost always a toxic overload. Something that's thrown the system off. And I tell this to all my patients. It's like, your thyroid just doesn't decide to misbehave today. You know, it's like, okay, I'm just going to go south on her and start misbehaving. Your gallbladder doesn't just decide to start growing stones,
Right.
you know, or your kidneys or whatever. It's something had to cause that, some imbalance, some accumulation of toxins. And so I was on this path, and here's the thing. I just was so turned on by this experience that I, like you, this is, you know, I have to say, when I walked in this morning, I told both Justin and Kate, I feel like I'm meeting family members for the first time.
Yeah.
And they handed me a greens juice. And I thought, okay, we're in. You guys are in the family now.
We made it. We made the cut.
We made the cut.
So I became insatiable. I was just a sponge for information, and I literally became a researchaholic. And
Back then, research was hard.
Oh yeah,
You're right.
I mean, we didn't have the internet yet.
Yeah.
It wasn't what it is today.
Yeah.
So I read. I just, how I put it is, I ate books instead of M&Ms.
Yeah.
You know, I'm from cover
was your
to cover.
diet.
And I just could not get enough information. So I cleaned out libraries and picked the brain of every vitamin department person I could find, and all the naturopaths and acupuncturists and nutritionists and so forth. So it was
pretty profound to have that happen at 21 years old.
Yeah.
I mean, how blessed are you?
I'm so blessed, because, you know, the worst thing I got as a child and growing up in Chicago with blizzards and everything was strep throat. So they did manage to take my tonsils, which, if I knew then what I know now, I would have never let them do that.
By the way, do you know what the tonsils are beneficial for? Same thing with the appendix. They take those out too.
They're glands. It's a gland that, well, the appendix is very much an important part of the digestive system. Of course, they don't.
They don't tell you that.
Yeah.
That. Right.
Well, they know that, but they don't give it any credit. But the tonsils are, they're glands that actually protect our immune system. They're part of the immune system that protect us from, and that's why they swell up and you get strep throat and you know, tonsillitis and all that, because they're absorbing toxins.
Yeah.
To protect
I had mine
our
taken
system.
Oh, I didn't know
it's part of the
that.
lymph system.
Back when I was a kid. Oh, is it?
gosh.
They're part of the lymph system. Yeah.
So you had yours taken out
At 16.
okay,
Yeah.
before all this.
Yeah. So the thing is in all my research, I realized how important it is to protect the immune system. And at 35, getting back to your question, Kate.
No, yeah.
Coming back to the trunk of the tree. My gynecologist thought he was doing me a favor by starting me early on my mammogram schedule.
Uh-oh.
Now, interestingly enough, the researcher that I was at the time, this is the first time I'd done any medical procedure, because I really didn't ever go to doctors because I didn't need them because I was so healthy.
Yeah.
Because I did this intestinal detoxing every year as a measure of prevention because I was so blown away by the result. And I thought, well, this is, you know, one way to keep toxins from accumulating, and I'll probably never get sick if I keep this up. So at 35, I go for my mammogram, and I didn't do my homework. And, you know, people warned me. They said, it could be uncomfortable. It was excruciating.
Understatement. Of the century.
Understatement. And I was so almost livid. It just threw me. I could not believe that they were doing this to the human breast tissue. And when you study the human breast tissue, it is incredibly delicate. It's got such a complex matrix of lymphatics, blood vessels, you know, milk ducts, milk glands, lymph nodes, connective tissue, fatty tissue, you name it. I mean, it's just receptor sites, hormone receptor sites by the thousands. And it's incredibly delicate. And to compress it with 50 pounds of pressure.
Is that what it's standard?
50 pounds of pressure. And that, I mean, no one talks about that. They all talk about the radiation, but the pressure alone can actually rupture milk ducts, milk glands, lymph ducts. I mean, DCIS, which is ductal carcinoma in situ, is one of the most common problems and where there's a lot of overdiagnosis and overtreatment. And it's probably from toxins that are trapped in the milk ducts, or vessels and, or milk glands. And, that could be from compression, because of the pinching off, if you will, of the blood vessels, lymphatic vessels, and the milk ducts.
50 pounds of pressure. That's a concentrated. It's not like it's a concentrated pressure in this
directly to an
direct
area.
source like that.
And the sad thing about it is what no one takes into consideration is that if there were a nice, neatly encapsulated tumor that had cancer cells inside of it, that it could rupture the tumor and spread the cancer into the bloodstream, connective tissue, and
lymphatic tissue, and get it spread all over the body.
Do you think, in your opinion, is that as bad? If there's a level of bad, is that as bad as going in and getting a biopsy to spread that way? Is it almost worse because
it's about the same.
Really?
As long as you're allowing it into the rest of the area, it's just as dangerous. And thanks for bringing that up, because no one talks about the dangers of biopsy.
We do.
Oh,
we
good,
do, yeah.
good. On all of our flyers in our marketing material, we have a chart that shows how long it takes for a cancer cell to double, which is around 90 to 100 days. And when you think of how microscopic these little guys are, it takes 5 to 6 years just to accumulate about 10 million cancer cells.
And what would that be in size?
That's about the head of a pin.
About the head of a pin.
10 million fits on the head of a pin. So if 10 million fits on the head of a pin, how many can fit through the puncture hole of a biopsy needle when a biopsy needle is thick? It's hollow core. So it's the diameter is very thick, very wide.
Wow.
And so you know that at least 10 million can get through that puncture hole. And here's where they find a lot of recurrence. If they go in, if they find a malignancy and they go in and they do a lumpectomy and take it out, where they'll find recurrence in the breast is in the track of the needle. Because those guys are microscopic, and then you can't close off the end of the needle. So they pull in the needle back through the tissue, and all these little cells are being seeded in the track of the needle.
Wow. So now, how often are women scheduled? When do they get started on mammograms, and how often do they say to get mammograms?
Well, let me answer that within the answer of the previous question.
I love it.
Okay, because typically it was age 40.
Okay.
And like I said, my gynecologist was starting me early at 35, thinking he was doing me a favor. And in a sense, and in the scheme of everything, he was. Because he, again, changed my trajectory just making that decision. Because at that moment that I did the mammogram, I swore I was never going to do it again. And that I was going to find there had to be another way to screen the breast tissue without destroying it. Yeah. Because then I learned that the radiation that they use is the strongest radiation known to medical imaging. There's two kinds of radiation. There's high dose and low dose.
Okay.
Misnomer all the way around, because high dose really should be called fast dose. Low dose should be called slow dose.
Okay.
And what that means is the way they send the rays through the tissue. So high dose is typically your chest x-rays and dental x-rays. Okay. Cuts through the DNA very quickly and very cleanly. So the DNA can still repair itself. It can still find its way back to its parts and repair itself. Problem with low dose or slow dose is that it moves through the tissue very slowly and literally annihilates the cells. Literally breaks them into who knows how many pieces.
Does this to the DNA as well?
To the DNA.
Wow.
And so that DNA can't find its parts. I mean, it's just irreparable, irreversible. It's not reversible.
Now, all mammograms use low dose?
All mammograms, and the main reason is because the tissue is so dense, and so, which is why they first have to compress it. So they're compressing the tissue because already the modality is inadequate
Okay.
Because it can't see through the density of the breast. So that's why they have to compress the breast so much.
So they have to help it along, kind of.
Yeah. And so here we have the breast tissue, the most distressed it can be with this 50 pounds of compression. And now they're zapping it with the strongest radiation known to medical imaging.
They're possibly bursting potential
and possibly,
tumors.
spreading cancer.
Yeah.
So the problem with the slow dose, too, is that it's called low dose, but I call it slow dose because they slow it down so it stays in the tissue longer.
How long after the mammogram is over?
Who knows? I really don't know. It just stays in there long enough for them to capture a better image. It lights things up better. Wow. So that's why it's also more damaging. It's 1,000 times stronger than a single chest x-ray.
Isn't that crazy?
1,000
times stronger than a single chest x-ray. This is the thing that just blew me away. So, okay. So I'm like, okay, I get it.
Wow.
Never doing this again. I turned 40 and my gynecologist starts bugging me. You haven't had a mammogram in 5 years. Now we got to get you on your, the standard program of doing them every year. I said, no, sorry, never doing that again. I know there's a better way. Started asking all the really amazing gifted practitioners I'd found in San Diego, natural health and healing practitioners, and found my way to thermography. Well, I was using thermography. When I found out what thermography could see, it was like, I don't want to just see the breast. I mean, that's not enough information. I want to see everything thermography can see. I was so excited, me being the researcher, right? It's like, what can it see? Carotid arteries. We could save people from strokes. We could see dental lymphatics, save people's teeth, so I did full body, and I was doing that every year as part of my preventive strategy. My annual physical was a full body thermography and going to a naturopath or a nutritionist. Wow. And 10 years into it, I detected a lump. And I was about 49, 50 years old. Mm-hmm. And I went to my gynecologist because they're the ones with the trained set of fingers and can tell you if something's threatening or not. And she had the look of terror on her face. And she said, I have to refer you to a breast surgeon. I said, a breast surgeon? Really? You think it's that serious? I mean, I'm the person who does not only the intestinal detoxing every year. Yeah. Okay. With the coffee and tea enemas and all that. But I'm the person who's carrying a cooler everywhere I go, so I don't ever have to resort to, I don't want to name names, but burger joints. Right.
You're in good company. We do the same thing.
Fast food of any kind. And I said, this can't be happening. There's just no way. And she says, well, I'm obligated to refer you to a breast surgeon.
So so she sort of has to, as in a professional
Well, I
capacity.
come to find out later on that there's some pretty distinct differences between something that's probably malignant and something that's probably not. Okay. If it's not, if it's like a cyst, especially a fluid cyst or a fatty cyst, usually soft and smooth and not fixed to the tissue. Okay. If it's a possible threat, it's usually fixed to the tissue, hard, and maybe even has rough edges.
Is that
all by feeling?
Mm-hmm. If it can be felt. Now here's the problem. They say that a lot of cancers are found by the patient, sometimes by their boyfriends and husbands. This is not when you want to be finding it. Because you don't have trained fingers. Even with trained set of fingers, they can miss it because our breast tissue, like I was saying how complex it is earlier, it is naturally lumpy. And so many of my patients say, my breasts are just lumpy. It scares me to check my own breasts every month because it's hard to distinguish.
And then you get worried.
Because everything has texture. I mean, think about it. We've got the milk glands and the lymph nodes and the ducts and all the blood vessels and connective tissue. And
I have to say, obviously, during certain times of women's cycles, we're more cystic anyway, aren't we? Yeah. Hormones are going
or you got the swelling.
Sure.
So I said, gosh. You know what? I think I'm going to see what my thermography has to say before I'm going to a breast surgeon. And I did the thermal imaging, and there was no indication of trouble in the area whatsoever. And so I went to a breast health specialist who was what I call a convert. She had been a breast surgeon, a mammographer, and she had become a thermographer and sonographer doing ultrasound.
Wow.
And she was an MD, and she was actually the president of on the board of the professional association that I eventually joined once I became a thermographer. And she taught me that cysts are actually a response of the immune system. Okay. And what we discovered was that what I had was a cyst. It was just a benign fluid cyst, but interestingly enough, I had 5 of them. And the only reason we detected this one is because it was on the real close to the edge of the breast, almost on the rib cage, and so it was protruding. And the other 5 were in the breast tissue, deep in the breast tissue. And she said, women get cysts throughout their lifetime, as you were saying, Kate, either during cycles or when their hormones are changing. During levels of high stress, grief, loss,
really?
Things of that nature. Absolutely. It's the immune system sending its most precious resources into the area because most fluid cysts, if not all, have white blood cells in them. And that's unlimited supply. I mean, that's provided by your spinal cord. That's where the immune system does its work and produces those white blood cells. So she said, the worst thing that you could do is aspirate a cyst, which is draining a cyst. Most women that are diagnosed with benign fluid cysts have those cysts. If they go to conventional doctors, they will aspirate the cyst. They will treat the cyst like it's the quote-unquote bad guy. When literally it's your immune system at work and trying to tell you that something's up or it wouldn't be working on something.
Yeah, I mean,
so it's like blowing up your own tanks.
Yeah.
It's, it's unfriendly fire.
Yeah, definitely.
And so I called the breast surgeon's office just out of curiosity and told them what was going on, that I had this lump and what's the usual process here. And they said, well, since there's something palpable, we'd probably want to get a sample, right? A biopsy.
Can I just ask how big it felt to you?
Are you
talking like a marble?
No, it was like the size of a, gosh,
like the end of your pinky or?
Yeah, like maybe my thumb.
Okay.
Half a thumb.
Okay, so it was little. I mean,
yeah, it was small, but it was sizable enough to feel it
and
see it on the edge.
I want to take a little break here, but I want to get back to this, and I want to talk, about the BRCA gene and the stuff going on with Angelina Jolie and where thermography can go.
All these juicy things to talk about.
When we come right back, I want to hear how this ends, though.
Yeah,
especially
people are going to want to know.
Because this is going to be
So we didn't mention this at the beginning of the show, but this is episode 363.
Oh my
so
gosh,
what we're going to do...
We're off our A-game.
I know, we're off our A-game. Is at the end of this show, we'll put a link. It's extremehealthradio.com/363. And we'll put all the links that we talk about, the different people we talk about, doctors and so forth, at extremehealthradio.com/363. And Lisa Kalison is here in the studio. She's been at this for 35 years. Her website is discoveryscreening.com. And we're having a great time. And we'll be right back right after this break. I wanted to tell you about this really powerful and unique product called the Q Laser. Did you know there's over 2,500 peer-reviewed clinical research studies showing the benefits of low-level laser therapy on the body? We had Dr. Larry Lytle on episode 165 talking all about it. Dr. Lytle, what is the Q Laser?
The Q Laser is a light-delivering device, handheld, rechargeable, that is for lay people and professionals, that works at the cell level of the body to restore energy. Since the body is all composed of cells and the cells are composed of atoms, it's good for any and everything in the body. It is especially beneficial for injuries. It will reduce swelling and inflammation before your eyes. Literally, you can have a sprained ankle and fly the laser, and within 30 minutes you can see that the swelling in the ankle has been reduced. Since all disease is inflammatory, you can assume that same process is working if you have some type of intestinal problem. We have pictures of using a heat instrument to diagnose the intestinal inflammation. We can show that intestinal inflammation is pretty much gone within 3 minutes using the Q1000 laser. It's the number one tool in your medicine cabinet. I have a saying, never leave home without your laser. I have had 3 serious burns, and each time I had my laser with me, I applied the laser immediately after I had the burn. I never even blistered.
Kate and I don't want to be without ours. We've worked out a special deal with Dr. Lytle for all of our listeners. If you'd like to learn more about how the Q Laser can dramatically improve your health, go to extremehealthradio.com/laser.
Would you like to feel more energy and a better sense of well-being? What's flowing through your blood makes all the difference. In my 22 years of nutritional practice, I've found that the food and supplements taken into the body determines to a large degree the amount of energy and happiness people have. One giant step in the direction of more energy and happiness is the type and quantity of protein you consume. 2 years ago, I was introduced to a whey protein powder that gave me more energy and a better sense of well-being. Having struggled with low energy, this was a welcome experience. This protein is called One World Whey. It is the first ever undamaged whey protein powder from grass-fed cows. People report the following: profound improvements in blood sugar and energy, elimination of pain, better bowel movements, detoxification, younger-looking skin and fat loss. Athletes love the strength and endurance-producing effects. Call 888-988-3325. That's 888-988-3325. Or visit oneworldwhey.com. That's oneworldwhey.com.
And in my opinion, this is the best raw grass-fed protein powder on the market. It's developed on Amish farms. It's got 25 grams of protein in each single scoop. Crazy amount of protein. Increases your glutathione levels. It helps to release heavy metals and toxins, decreases inflammation all throughout the body, especially in the gut. And not only that, but it helps you build muscle and increase energy as well. It has tons of anti-aging properties. So really, really great protein powder. We like to use it every day in our smoothies. And our resident cancer guru, Ty Bollinger, what do you think about One World Whey?
Over the commercial there, you're talking about One World Whey. I want to encourage anybody that's listening, go to their website, go to Justin and Kate's website, and buy the One World Whey. That's something that we include every day in our diet. Every lunch, we have a One World Whey smoothie with super greens mixed in with it. It is fantastic. It's the best protein you're going to get. And as they mentioned, it's from grass-fed cows. It's organic. It's cold pressed. I mean, it is. You're going to get huge nutritive values from this One World Whey. It's the best protein on the market, I think. So, then that's something that most people are deficient in is quality protein. So I highly recommend you go there and go to their website and buy this stuff. It's the best that's on the market. And I'm good friends with Stephen Hewer, who is the owner of Synergistic Nutrition, and he's a quality guy, and they have excellent customer service as well.
Yeah, he's an amazing guy. We interviewed him on episode 88, and he's just an amazing guy, and I really love what he's doing. That's why I love supporting his work and love taking his products as well.
Yeah, great stuff.
And if you'd like to support Extreme Health Radio and the work that Kate and I do, you can get your hands on this One World Whey protein powder that I love so much at extremehealthradio.com/whey. That's WHEY. Or you could check it out in our store as well. That's extremehealthradio.com/whey.
100% listener supported. Extreme Health Radio. Opening minds and transforming lives worldwide. Don't forget to join our thriving community for health tips, inspiration, and show updates at extremehealthradio.com/Facebook.
Okay, I forgot to ask. People can hear us okay in the chat room?
Apparently.
Good?
No one said anything. So.
Okay, there's a setting
I'm assuming
here.
They're listening to us.
There's a button here I forgot to press, but I think everything's going good.
I think they would have bailed out a long time ago.
Yeah, they would have bailed out a long time ago if they couldn't hear anything.
If anybody can hear, let us know.
We're with Lisa Kalison, her website. If you guys want to check it out, we'll put a link to that. In fact, I'm going to do that right now. DiscoveryScreening.com. We'll put that in the chat room. I can say that correctly. So that you guys can check that out. And before the break, we're sort of finishing off your story
about calling the breast surgeon.
Yes.
Yeah.
Okay.
And asked them what the usual process was, and they said, well, again, because it's palpable, they would want to test the tissue. So if it's a biopsy, if it's fluid, they would aspirate the cyst, which I'd already been told not a good thing to do, bad thing to do, or they would biopsy if it was solid of any kind. They would test it either way, fluid or solid. And if they felt that there were any rogue cells or even, slightly heading in the wrong direction, felt it was a threat, they'd probably want to do a lumpectomy.
Okay.
I said, thank you very much for the information. I'll get back to you.
Yeah, right.
I never called again. But it's at that moment, again, another change in trajectory. I just got it that thermography had saved my breasts from going under the knife unnecessarily. And in further research, I discovered about 40 to 60% of breast procedures are completely unnecessary.
40 to
60%.
Breast procedures, and that's all kinds of different
the
procedures.
Aspirations and the biopsies and the lumpectomies and including mastectomies. I don't know if it's 8,000 or 80,000 mastectomy, 8,000 mastectomies, I think, a year are completely unnecessary.
Oh my gosh.
So I got to just ask you about this whole Angelina Jolie
here
thing.
we go.
Well,
I mean, we can't not cover this.
I know.
That.
So to finish that thought, I fell in love with thermography at that point. I thought, I could do this for other women for the rest of my life. If I could save them from what I almost succumbed to, on all these unnecessary procedures. Because one of the things I did find out too is that anytime you cut into the skin, this is applicable to anything, the skin is a protective barrier against the outside world. And this is why people die in hospitals of things they didn't even go into the hospital for.
Happens all the
time. All the infections, staph infections, and other complications. And especially with the breast, you cut through the tissue, you are invading a very pristine, sterile environment that your immune system is desperately trying to maintain homeostasis and keep that tissue clean and free of any foreign invaders. And now you've opened it up, and even if it's benign, you have literally set the tissue up for degeneration and possible eventual cancer. So this is why it's best to not invade the tissue if you don't have to. 80% of biopsies are benign. 80%
of biopsies are benign.
Tells you how many are probably unnecessary. And my understanding is they charge anywhere from $20,000 to $30,000 per biopsy.
Gosh.
And how long does a biopsy take? I'm sure there's different times, but
it doesn't take very long.
It's not an in-depth medical procedure.
No, it's usually pretty quick.
And, so
they're standing by if they see anything. I've had patients call me from the mammography room in tears saying they swear it could be, it's like 99.9% cancer and they should do a biopsy right away. And I say, you tell them there's a 99.9% chance you're not going to die tonight. And you're going to go think about it and get second opinions and all that. Right. But the person was standing by with the needle. So there's a huge fear factor that pushes people through pretty quickly, and it's
a doctor
pretty
convince a scared patient of to do anything.
Yeah. And the sad thing about mammograms is that they miss even when the growth is large enough to be seen, which takes 8 to 10 years, and the average that it's found is 10 to 12. So the soonest it can be seen is about 8 years, about 4 billion cells strong.
4 billion.
4 billion plus. So by the time it can be seen, it's still going to get missed at least 75% of the time if there's breast density, and just 20 to 30% overall will be missed. And the overdiagnoses is what's also scary. There's so many things. Women can have scar tissue, lesions that aren't even a threat, calcifications that will never become life-threatening, even if there were cancer cells inside of them. That's what a calcification is. The body has encapsulated it and calcified around it to protect you from it. Women have been biopsied and autopsied even after death and found all kinds of breast cancers and carcinomas, ductal carcinomas, all that, where that's the thing that would never have taken their life. So the overdiagnoses, the false negatives, false positives. Unfortunately, mammograms are notorious for that.
And that happens a lot with people, that get in car accidents, things like that. They'll do autopsies, and people are living with all kinds of different cancers, and possibly the body would have just eradicated that cancer given enough time. And so, how come
a lot of cancers remiss themselves?
Yeah. How come a lot of the breast cancer tumors that do grow, that are breast cancer, is there a reason why lots of them are sort of hanging out on the side and at the outer edges of the breast?
Most likely because they're in the lymph.
Okay, so it's sort of connected to the lymph tissue that's under the armpit.
There's strings of lymph that go up diagonally from the part of the breast that at the top part that's closest to the axilla. They call it the armpit, the underarm.
Okay.
And then there's a strain that goes almost from the 12 to 1 o'clock position of each breast and up the chest to the clavicle.
Is there any connection with the tight bras women wear and that?
Oh, absolutely.
We've had a lot of guests talk about that.
Well, you think about it, the lymphatic system is very delicate, and it's tied to the sympathetic nervous system, so it doesn't require really firm massage to move the lymphatic, which is why rebounding, I see you have a rebounder in the room, it's one of the best things you could do, because all it needs is a gentle kind of massage, a bouncing, because it's actually the upward motion, because most of the lymphatic system actually flows upward. So it's very important to have an upward motion. It doesn't require a lot of stimulation, but if you block it, if you apply any pressure to a lymphatic system or a string of lymphatics or lymph nodes, now you're allowing, because the lymphatic system is the sewage system of the body, you're allowing these toxins to get trapped in that system. And there's a huge matrix of lymphatics all the way around the breast tissue and through the breast tissue. Looks like as sophisticated as a spider web. So very complex matrix of lymphatics, and under the breast tissue especially. So if you wear an underwire bra, it's pressing against the lymphatics and trapping. And if it's made of metal, now it's interfering also with the electromagnetic and the electrical system of the body.
You know, we see all the time is on the beach trail down here is we'll see women with the tight bras like that.
Really
but then
tight sports bras.
They'll have their cell phone.
Oh, and have the cell phone in there, and that's where they find a lot of cancer, is where the cell phone was held
saw
in the
that
bra.
Just yesterday.
Please don't do that.
My goodness.
Don't do that. Get headsets wherever, and use headsets whenever possible. If you can find one that has an air tube, that's even better, because even the wire can carry the signal and become like an antenna in your ear. So the
underwire bra with the metal in there is affecting the
electrical system of the body too.
Yeah, and the EMF fields, I'm sure, would probably connect with that and communicate with that.
Can I ask you what you would say to women who are listening to this about what we do about not wearing bras? I mean, are we still wearing them? Are we wearing different kinds? Are we wearing more cotton?
Well, what I have found,
underwire.
Yeah, the ones that don't crush your breast against your chest is probably a good thing. Sports bras are okay, because you don't, if you're going to be bouncing and you have heavy breasts, you certainly don't want to tear the tissue.
Right.
But get them off as soon as you can. Our breasts are actually kind of meant to sway in the wind.
Yeah.
And, a lot of women don't probably cringe when they hear that, because they don't want, flat, hangy breasts.
Everybody wants to be a Victoria's
Secret
model.
They don't want to be perky,
So we've been sold.
Yeah.
Right.
But, ask any man, he'll love your breasts. If he loves you, he'll love any breasts. And he doesn't love your breasts because they're yours, then he's not the man for you.
Thank you.
And he'd rather have you alive too.
Exactly. Right.
Yes, absolutely.
Right.
So it's best to get them off as soon as you can. I actually found the most supportive bras that are the most comfortable are nursing bras.
Really?
And I actually wear a nursing bra.
Wow.
Yeah.
Yeah, and it's becoming a growing trend for women to take off their bras when they get home, and but then a lot of women too, just wear them all 24/7, and that's an issue too.
They wear them at bed. Not good.
Yeah. I cannot get over that.
Here's what you got to realize too: is the lymphatic system is 4 times the volume of your blood. Your blood circulatory system. So there's 4 times the lymphatic vessels as our blood vessels, and 4 times the lymphatic fluid. So that's how important your lymphatic system is. You do not want to be blocking your lymphatic system because it also delivers nutrients too. It's playing a few different roles, and it's a huge element of your immune system. So you've got to have that lymphatic system flowing. So here's what I do. Also, if you're heavy breasted, and a lot of women say, I have to have an underwire. Well, most underwire bras are still constructed very well for the support. So what I do is some of them actually have the wire on the outside of the construction of the bra. Either way, I'll buy those and I'll take the wire out. Oh. So you still have the construction that has the support that you need. Yeah.
Okay. Very cool.
So that answers your bras question.
Yeah. I am. A lot of people will be curious about that.
Yeah.
Wow.
So.
My gosh. So I know we'll ask the Angelina question and all that.
Well, I just see this preventative mutilation. It's just, I have to ask, but go ahead.
No. I think that's an important topic to cover.
So I'm sure when you saw that headline, I mean, what did you think?
Yeah. Right.
It broke my heart.
Yeah.
It juiced and, if you will, fueled the fire for me. Just fed my passion for getting the word out about thermography. My heart sunk because I thought, if she knew about thermography, she would not have had to have that done. Because the thing that people don't understand about the metabolics of the human body is that we are thermal beings. The first time your mother used thermology was when she put a thermometer in your behind when you're an infant, and you've been using thermology your whole life to see what your thermal readings are, your body temperature. And Hippocrates even used to spread clay on people, and where it dried the fastest was where the greatest heat was, where there was inflammation.
Okay.
So it's as scientific as science can be. We are thermal beings, and it's either hotter than it should be or it's colder than it should be. Both are equally important, because even the hypothermic spots, it's hyperthermic is hotter, hypothermic is colder. You saw the movie The Titanic, that people in the water didn't do so well. That's called hypothermia.
Yeah. Not so good.
Hypothermia, not good.
Yeah.
So cool spots is where there'll be reduced function, reduced circulation, dysfunction.
Okay.
We see a cold spot at the T2, the thoracic 2, at the base of the neck, top of the back, and that tells us of autonomic dysfunction, which means your nervous system is being your immune system and nervous system is being challenged and chronically activated. So that could be a systemic infection of some kind, viral infection, bacterial, tooth infection. So that's an important indicator. And hot spots are obviously, we all know that most disease starts with inflammation is the first sign of degeneration. It's not the cause of disease, and we got to be real clear about that. What caused the inflammation is what we got to get to, right? Yeah. And a lot of times it's pH, and what causes the pH problem and acidity is, our diet. Most diseases are diseases of the fork. Started there, and or the emotional factor, which can create a very acidic environment as well. But getting back to the whole element of the thermal is, if we see inflammation in the carotid arteries, we could be saving you from a stroke, because that could be indicating that there's plaquing going on when you have no indication of it. We could see dental lymphatics inflammation and tell you have a tooth infection or a bacterial infection or something way before you'll ever feel toothache. This is the key thing that no one tells us. And if everyone knew just this one thing, it would probably change a lot about where we decide to go and what we decide to do about our health. And that is 90% of the human nervous system is functional, not sensory. Not sensory. That means 10% of the time can you feel what's going on. 90% of the time you can't, which is why cancer surprises us. We can't feel those rogue cells becoming cancer cells. We can't feel those cancer cells duplicating, replicating, until they're choking off an organ, rotting an organ, hitting a nerve, or we're like emaciated and wondering what the heck's going on, or we're losing energy. So you don't want to wait until there's symptoms. You don't want to wait until you can feel something. Because 90% of the time, pain is your last indicator, and only 10% of the time is it your first. So this is the gift that thermography gives us, is being able to visualize that metabolic activity or inactivity. More where there shouldn't be, less where there should be.
Wow.
And it's the greatest gift is to visualize. I mean, picture's worth 1,000 words, right? Seeing is believing. And I can tell you that when my patients see the visual map of their body and where their immune system is literally raising the red flag and saying, hey, or the blue flag where it's cold, I need help over here. I mean, truthfully, it's literally waving the flag and going, there's something up. This requires further investigation. And that's the beauty of thermography. Because we are thermal beings, it shows us where there's things that are up where we may not be able to feel them. Now, in most cases.
Is thermography, is it a field that's constantly, is the technology getting better and better and growing all the time?
Just like any other technology, leaps and bounds. I mean, my camera made a quantum leap in the industry. It's the most sensitive camera that's ever been developed.
How deep does it go in the body?
Well, here's the thing. It's not giving off any kind of energy or ray. Which makes it non-invasive and can't harm you. It's actually receiving the signal that's coming off the surface of your skin from about 3 or 4 inches deep. which is pretty dynamic.
So when someone does a full body scan, do you typically have them turn over and then
they're standing? Actually, it's like sitting for a photography session. It is the most simple, non-invasive. We provide complete privacy. No one sees or touches the patient disrobed. It's very respectful environment.
Unlike the TSA screenings at the airport.
Yeah, I'm sure you do.
Unlike that.
I'm a former grief recovery counselor, so I am very sensitive to people's comfort and especially their discomfort because you have to create a lot of safety in that environment. Because I specialize with women and severe traumas from childhood. So I had women coming in kind of guarded, and because we're trained to face the patient when in our training. Okay. And there's no thought given to privacy or modesty because we're using nude models. But when the general public started coming in, one woman said, "What do you mean I have to get disrobed for this?" And I think because women don't have to bare their breasts to be squished or crushed and radiated, they don't think they have to be disrobed for this. Well, you do, because the skin has to be exposed, because the skin actually has to cool a little bit. So the room's on the cool side. It's not cold, but cool enough that the same phenomenon as frostbite occurs, which is called uniform vasoconstriction. And that's causing all the blood vessels that are healthy to constrict. So we see where the remarkable things are, where it's more remarkably hotter or colder than it should be. So there's a lot of thought given to sensitivity and the environment and setting it up so we get a really accurate reading. But the camera is incredibly sensitive, so much so that the older technology, and I see some of the images. These are the older technology images on your screen, and it's so perfect that you're showing this.
Yeah, I was going to ask
because if you look at her hair, it's almost like cartoon hair. You barely see a strand, right?
Right, it's all blue.
With my it's like a white. It's just like a brush stroke. With my camera, you can see individual hairs.
So this is an very old picture.
That's very old technology.
Wow.
Yeah. We're showing the older images on this.
Isn't that amazing?
Yeah. So
can you still tell quite a bit from?
Oh, absolutely.
Looking at
this
right
we're still going to see where it's hotter or colder than it should be. But the thing about the high definition, the high sensitivity, is we're going to see changes quicker, earlier, more definitive and finer detail in the changes.
So you could see problems or areas of inflammation in the body long before or years before something would ever grow?
Years before it's even cancer or a disease. Again, inflammation is usually the precursor, right? Or dysfunction. So if the whole left side of the chest is colder than it should be, because, you know, where there's blood, there's heat, and the heart's right there, if it's pumping enough blood, your chest is going to be nice and toasty.
Wow.
But if it's not, it's going to be, we've seen one of our sample images, the guy's chest is cold, it's blue. Ooh. So we were saving this man from a heart attack. He had no idea why he was fatigued. It's because his heart wasn't pumping enough blood.
Could you see the arteries? Or
no, what we're seeing is the thermal indicator that the heart's not pumping enough blood.
Okay.
So they've seen, now here's the thing, that this technology has been around since the early 1950s.
Wow.
It was classified and top secret, developed by the military as night vision.
Really?
And that's how they saw it at night. And they released it. They unclassified it in 55. It was picked up immediately by the construction industry. If you can imagine, they could see ventilation leaks, hot, cold, and even save people from the dangers of electrical fires by seeing cracked wires and things of that nature. The medical industry picked it up in 1956, 57. Right around the time that mammograms were first being used. And by the way, mammograms are only meant to be used once a woman was already diagnosed with breast cancer, to use in surgery to guide the surgeon to find the cancer to remove it. It was never meant as a screening tool. It was never meant to subject the human breast to that kind of compression and radiation every year of a woman's adult life.
Wow. We're going to take a little break really quickly, though, but wow. So it was never meant for that. And yet it's
no, I think our jaws drop at least
someone's
4
clever
times during
idea.
a show. And this one's like 10 drops. I'm like, what in the world's going on?
Oh my goodness. Please send this show out to any female you know.
Yes.
Or oh man. All right. So we're going to take a little bit of a break. We're with Lisa Kalison. Her website, if you're interested, is discoveryscreening.com. Great stuff. We'll be right back right after this.
Thank you.
Did you know that conventional dog food contains antibiotics, herbicides, pesticides, ground up carcasses from roadkill subjected to high heat processing, artificial colors, chemical preservatives, way too many carbohydrates, genetically modified corn syrups, indigestible grains, and a lack of moisture content in the dry kibble? Obviously, this can lead to health conditions like diabetes, itchy skin, teeth and gum problems, liver damage, obesity, behavioral issues, pancreatic problems, and even cancer. That's why we recommend the BARF diet, which is the biologically appropriate raw food diet from Barf World. Their unprocessed raw meats contain bone, organ meats, vitamins, and minerals that are loaded with enzymes. Barf World founder Robert Mueller explains more.
Sure, I don't have to convince you on the damage that's caused by high heat to food. So as a result, we see many skin disorders, a lot of arthritis, obesity, heart disease, cancers. I mean, it's just rampant. The vet clinics are just full of these conditions. And basically a large percentage of the commercial pet food that's made up of the human industry leftovers. And the pet food industry makes use of this waste product. And in addition to that, we are subjected to the products coming out of the rendering plants. Garbage in, garbage out. If you feed garbage to your dog, you're going to end up with garbage health. You know, if you put the right gas in, your engine runs smoother and lasts longer. So if you put the right fuel in the tank, you're going to get the right output. Garbage in, garbage out.
We've seen an immense difference with our dog Maggie being on this diet. Give your dog the gift of health today by going to extremehealthradio.com/barf or go to our store. That's extremehealthradio.com/barf to learn even more.
I have to say, I have been absolutely loving this product by Tristan Truscott and Peter Ragnar called Good Morning, Good Evening Qigong. If you want to listen to the interview we did with Tristan, you can go to extremehealthradio.com/127. And Qigong is a great way to de-stress the body. And as you know, there's a huge component to disease caused by stress. And stress is a huge factor in how we live our lives and the amount of energy we have and the amount of vitality we have. And so, Dr. Shade, what do you think about Qigong?
People come to me and they're really sick and they got this blown out neurological system and all this toxicity. And I tell them, you need to do Qigong, Tai Chi. You need to do these things that settle down and restore your neurology, because it puts together all the parts. It puts you back into that state where you can start to detoxify. And so I highly, highly recommend all that.
And what about you, Kit Campbell? What do you think about Qigong? Do you like it as well?
Qigong is amazing. And the reason that I believe it to be amazing is everything here is energy. That is a scientific fact, if there ever is one. So when you're practicing Qigong, you're actually drawing energy into your body. Your intention, whatever your intention is behind any action, will determine the level of energy, type of energy that you absorb into your body. So your intention behind is very important, just like thought. So when you're practicing Qigong, you're actually bringing energy in and you're bringing out the stuff that might be a bit stale. With Tai Chi, it's totally different. The energy runs underneath the skin because it's more of a martial. This is the Chinese understanding, by the way. It's more of a martial art. So Qigong is very, very good for bringing that energy into the body, and just fantastic.
If you're interested in picking up this Qigong course by Tristan Truscott and Peter Ragnar, go to extremehealthradio.com/Qigong. That's QIGONG. And you can learn more about it. There's a great video on that page, and you can learn more about it on that page. And I highly, highly recommend this product. I love it myself, so go ahead and check that out. extremehealthradio.com/Qigong.
All free shows, all the time, on Extreme Health Radio. Opening minds and transforming lives worldwide. Join our community today. Sign up to our email list and instantly get our free gift to you, along with loads of inspirational content and cutting-edge tips to help change your life at extremehealthradio.com/subscribe.
Well, today's just a little educational session, isn't it, Kate?
Oh my gosh, little.
Quite a lot.
Man.
We are with Lisa Kalison, and her website is discoveryscreening.com. Very fascinating stuff. I would highly recommend you guys check that out if you're interested. But I really do wish, we're talking during the break, that there's just too much invested, I think, in the mammography
business. Let's call it a business.
Industry. We're talking about Angelina Jolie. We're going to get back to that in a little bit. Lisa's actually in the restroom right now, so she'll be right back.
A little too much green juice going on.
A little too much green juice. She was talking about Angelina Jolie being a sort of a hero in that industry, and I think a lot of young women are looking up to her, and a lot of people writing articles about what she's done in terms of prevention because she's had this gene. But what a lot of people aren't realizing is that just because you have the gene doesn't necessarily mean that gene needs to be expressed. And usually that's through diet and lifestyle, emotional issues, past traumas, all kinds of things like that. And it's just so sad because she's such a huge star, and any time she does something like that, something that's written about.
Huge influence.
It's a huge thing.
Huge influence.
It's really sickening.
And that again, is why it broke my heart, because if she knew what her options were, and if she knew about thermography, she could monitor her breasts every year, every 6 months, however often it would have brought her peace of mind.
With no harm. And we have a 92 to 97% accuracy. And when you put that together with ultrasound, because we're seeing the metabolic, what we call the physiological level, and that comes first before structure, before anything can accumulate, and before cancer cells can show up on a mammogram, ultrasound, CAT scan, MRI. We're seeing the metabolic behavior. We're seeing the response of the immune system to what's going on, the trouble in the area. And if she had known that she could have used thermography to monitor her breasts, and at the first sign of trouble, she could have done something preventive. My goodness, there's ways to treat cancer that have been known about for centuries. 400 different natural treatments for cancer, pH and herbs from the Amazon rainforest. Oh my goodness, poultices that you can. I know patients who have put a poultice on their breast and pulled the tumor out through this tissue, and it closed up as though it was never there. Like a black salve kind of thing?
Yeah, black salve, or there's a black super draw poultice that Dr. Schultz has a recipe for in his Known Curables program.
We've seen that. Even in men, I saw there's a story of a guy doing that through his back.
Oh,
that
was intense. Yeah, I remember that.
It's if you just know what causes it in the first place, that's everything. But the sad thing about Western medicine is that they treat symptoms and manage disease. They don't ever get to root cause. We've never had a patient who's gone through, whether it's a lumpectomy or a mastectomy or biopsy or any procedure where they found cancer, have they ever told them to do anything different? Oh no, just go back to your normal, regular life and enjoy it. And
we don't know.
You
why
might want to stop
happen.
smoking, but it's like
I had a friend, I just laugh, but I have to say this, who had her gallbladder out at my work because she wasn't able to eat any foods. Right? She gets her gallbladder out and she goes, "I'm so excited. My doctor said I can eat donuts again."
Oh my!
And that is the sickening part of it. She said, "I can eat whatever I want again," and she thinks she's quote getting away with this now, and she's back to eating her greasy, fatty, sugary foods.
And the sad thing is she can't metabolize them.
Thank you very much.
At all now because she doesn't have a gallbladder.
But how ignorant and just, people are so quick to show up and say, just take something out, burn it, slash it, get it out, and then I can go back to how I want to live.
Exacerbates the problem.
The crazy thing about cutting the breasts off to be prophylactic, to prevent, the sad thing is if you have a propensity, if you are already doing that kind of greasy fast food, if you're living the lifestyle that's going to cause cancer, well, just because you don't have breasts doesn't mean you're not going to get cancer. You're just not going to get it in the breast.
I know, right?
You're going to get it somewhere else. It's that's what's so silly about it. And so if you want to go with that mentality, it's like, well, my family had kidney problems. I guess I should just have a kidney implant right now. Transplant.
Just get it removed.
Just cut them out. Or cut out. Or I could break my arm. So why don't we just cut my arm off? It's just kind of a silly. Because here's the crazy thing, is that cancer is a symptom. Cancer is not the problem. What caused the cancer is the problem. but they're treating the symptom. And no one puts that in perspective. And that's why we hear things in our natural community. Cancer is not a death sentence. It's a wake-up call. It's your body telling you, hey, I wasn't able to deal with this. You better help me out. That means the immune system is depleted. We are dealing with deficiencies today we've never dealt with before. We're dealing with toxicity we've never dealt. There's 1,000 more chemicals in existence today than existed 50, 100 years ago.
Right.
That our parents and grandparents never dealt with. And our immune system is reeling in a tailspin from this toxicity, not knowing what to do with all these chemicals, especially in our food.
Right.
And in the air, and we're cooking the food to death, we're processing it to death, so we're denaturing it. So the human digestive system goes, what is this?
How can I even
Tastes
live?
like a potato, but doesn't look like one, molecularly,
right.
On the metabolic molecular structure. It's like not, even if you put it in a microwave, totally alters, denatures the food. No one knows this. We see people microwaving their food all the time, and restaurants do
plastic
this.
In the,
and then they're doing it in plastic, so there's off-gassing into the food. And then you think about the nonstick cookware gassing off terrible toxins into your food. So all the way around. And then we're putting, these really toxic, cheapo things you can buy at, the box stores. I'm not going to name any names. We're putting the highly chemicalized, toxic hair products on our hair. And everything you put on your skin gets absorbed in your bloodstream. Doesn't have the benefit of going through your digestive system.
Which is even worse.
It's just worse.
It goes right into
Direct
blood.
Right into the blood.
A lot of people don't talk about this too, is the when someone has a surgery, that scar tissue that's at the sign or at the scene of the surgery that forms there blocks the energetics of the body. And so you have that whole issue too, where even if it's a small scar, you're going to have to mud pack that or unblock the energies through the meridians. And so people don't realize that,
Well, and then there's heavy metals. There's so many heavy metals in our air, in the chemtrails that they say are, controlling the weather and the precipitation and all that. And it's like, there's lead in these chemtrails. Like, what? I'm breathing this stuff?
Aluminum too, right?
And aluminum. I have lead poisoning right now. I'm actually working on a chelation program to eliminate the lead from my system.
What are you doing for it?
Oh, well, that's a whole...
that's a different show?
That's a whole other show, I think.
Wow. Are you in the midst of the process now?
All kinds of natural clays and chlorella and spirulina and things that can pull the metals out.
Good for any kind of cancer.
Oh, good for anything. Because heavy metals contribute to the breakdown of the immune system, too.
Did you find that to be through thermography? I mean, can you pick up on those kinds of things in the body? Or was it...
what we pick up is where the weaknesses are.
Right.
And this is the thing that we all need to understand, is that no one knows what their weak spot is. You don't know what your weak link is until it's been weakened, until you're starting to see signs of where your weak point is. So this is why thermography is such a powerful preventive tool. You got to realize too, if structural machines, devices, imaging devices like CAT scans, PET scans, mammograms, MRIs, and even ultrasounds, if all they can see is solid structure or mass, and by the time something is a solid structure or mass, it's way threatening. It's like life-threatening. It's way advanced. Then they're really seekers of advanced disease. That's really what they're looking for, because that's all they can see. They're not preventive.
They're looking for disease.
It's good news when they do one and nothing's found, but what do they tell you? They give you no guidance. They don't say, go and keep your pH alkaline and eat greens juices every morning and bounce around on a rebounder. No, they're not going to tell you that. Yeah. And I can't tell you how many patients come to me and say, well, I have this and I have that. I have this little lump and I have this. And they just say, well, let's just wait and see. Wait and see what? Wait for it to get so much worse that, okay, now we're having to deal with a mastectomy? Yeah. So that's the crazy thing. There's no training in that arena for prevention. It's not their arena. I don't want to throw the baby out with the bathwater and literally annihilate an entire faction of people. I want to do a disclaimer, or what do you call that? I want to say that I trust and know that every person who ever went to medical school, be it a nurse, any kind of practitioner, doctor, surgeon, I really believe that they intended to be of service, and they had no idea they were getting into a system that treats symptoms and manages disease. Right. and is not trained in prevention.
Mm-hmm.
So I want to give them that. And I also want to say that where I have the highest respect is emergency medicine.
Right.
That is the greatest gift of Western medicine. And that's the faction of Western medicine that I really trust.
Mm-hmm.
If I get sick, I'm not going to a doctor,
mm-hmm.
not a Western doctor, unless they're alternative and they integrate
right.
with natural medicine, natural health and healing.
But if you break your arm,
right?
Yeah, sure.
You know,
put a splint, put a cast, whatever. But that's the sad thing is that no one's taught these things about 90% of the human nervous system being functional, not sensory. No one's taught that there's a root cause to everything, and that we're at the cause. We're at effect.
Are you finding
cause and effect
an association or a link up at least with the dental health and the oral pathology?
Absolutely. And thank you for bringing that up, because that's one of the most powerful things that thermography sees
mm-hmm.
is the inflammation in the dental lymphatics under the jawline. It's called the submandibular cervical lymphatics.
Okay.
And it's the mandible is the jaw.
Uh-huh.
That's easy to
Sub, meaning under, of course.
Right.
And when we see inflammation there, and sometimes it's very distinctive. Even around the mouth, we can tell if someone has periodontal disease,
mm-hmm.
if they have root canals that have failed,
mm-hmm.
cavitations that have failed. There's infection in the wisdom socket. They had the wisdom teeth pulled, but the infection was left in there when it sealed up.
Wow.
So, and they can't feel that. That's, again, that 90% factor. By the time you feel a toothache, that infection has been there a minimum of 5 to 10 years.
Oh, my gosh.
Maybe even 15.
Wow.
And then don't even get me on the amalgam fillings element. Talk about, metal toxicity,
We've
mercury
gone to
being
a doctor and had all this work done on our teeth, and I have a
yes, I saw them on your site.
And I have,
I have high regard for these dentists, these biological dentists, because they're really walking the fine line, and because they're Western trained,
mm-hmm.
and to go biological and holistic is. It's a stretch for them. It's a risk.
A dentist that we talked to in Ecuador, and his
mm-hmm.
name's Dr. Bob Dowling. He does a lot of this same thermography work type
mm-hmm.
of work, and
mm-hmm.
He's done scans where he's shown the line going from someone's tooth to their breast,
to their heart, or their
you see the lymphatic drainage, and you see the inflammation throughout the entire lymphatic vessel.
Crazy.
It is crazy. And one of the things that we've discovered is that 90 to 95% of breast cancer patients had some kind of tooth infection they either didn't know they had or were neglecting.
How many?
90 to 95% of women with breast cancer that have been tested has some kind of tooth infection they either didn't know they had or were neglecting.
Oh.
Wow. I'm surprised.
So there is that's the most dangerous bacteria in the human body.
It might even be higher.
The spirochetes and all the other bad guys that are in there. We have our biological dentist down in San Diego. He tests the saliva for the parasites and candida and bacteria and everything.
What's the name of your doctor, just in case people are in the
His
area?
name is Dr. Carey O'Reilly, CareyO''RIELLY.
Okay,
and his website is myholisticdentist.com. Holistic spelled with an H. And he's brilliant. He's taught other dentists how to become holistic dentists. And he does ozone injections and things that can actually preserve the teeth and help keep infection at bay.
Mm-hmm.
We had our silver fillings taken out, root canals taken out, our cavitations fixed from our wisdom teeth.
Wow.
Teeth pulled out of our mouth.
Massive.
Yeah, we both have,
all root canals fail.
Mm-hmm.
Sorry, kids. All root canals fail. There's we have another biological dentist in Irvine who comes to a lot of the lectures and weekend seminars that I do, and we are very often in each other's audiences. And he's always stood up during my presentation and said, "Listen, you guys, I have all the bells and whistles, the most expensive equipment in the industry, and my dental X-ray machine, the best one ever in the world, can only see about 30% of what's going on in your mouth."
Wow.
Here's
what's his name? But just in case people are listening.
Oh, Randolph Aguilera.
Oh, okay.
Dr. Randy. Randolph Aguilera.
Okay.
And the thing is, he says that when a dentist shows you an X-ray and says, "See that dark spot? That's where the infection is." That's not the infection you're seeing, that's the loss of bone. It's what you're not seeing that's the problem. The bone is gone because the bacteria has eaten it. You do not want to wait until there's a dark spot on an x-ray. And here's the problem with x-rays again and structural devices. By the time you can see it, it's advanced and you've lost the tooth. So you want to be as preventive as possible, especially with your dental health. And acidity in your mouth is one of the key things. Wow. So if you gargle with just a little baking soda water once or twice a day before you go to bed, that can preserve your teeth for your life. Yeah. It's just remarkable.
Yeah, we do that.
We do this.
Yeah, that's definitely
so. Yes, dental health has it can that bacteria can cross the blood-brain barrier. It can attack your heart tissue. Again, it can contribute to breast cancer. So many issues that it can contribute to. So dental health is key to your overall health.
That's amazing.
Then you got to think about the metals in the mouth. So if you have conflicting metals and you got a battery effect, now it's throwing off your whole electrical system.
Yeah, because a lot of times people get metals, different kinds of metals in different teeth. And so then they have that issue where they're conflicting with each other, and then they're also conflicting with the radio waves and stuff like that. Have you ever heard of people hearing little frequencies or whatever radios
Absolutely.
in their head? Yeah.
It may even be part of what the tinnitus is all about.
Could be. Yeah.
Some folks is the electrical.
We get a lot of questions with tinnitus.
Well,
actually.
Yeah. I mean, think of the radio waves and the cellular waves we have today. The EMFs. We're all in front of computers.
Yeah.
We have 3 cell phones.
Yeah,
2 personal and a business cell phone and 2 laptops, and they're always going.
They're always going.
It's
hey, Kate, I wanted to ask you, or you were talking about this during the break about a couple naturopaths.
Yeah, this is very interesting, Lisa. I wanted to ask you about this. I touched on it last week on our Friday show. I said that I was going to ask Lisa when we had her in studio about this. Yeah, what was it? About a year and a half ago, I found a tiny, feels like the size of a pea, little lump. Kind of moves around, doesn't feel, it's really hard to find.
It's a love lump.
The love lump, because I'm loving it. Back to
you have to love it. Yes,
but I remember going to get an ultrasound because we happened to be going to a place where they did a full body ultrasound, and the technician said, "Oh, I'm pretty sure it's a little cyst, no big deal, whatever." Well, the naturopathic doctor that was working alongside him said, "No, you need to go get a mammogram. You need to go get a mammogram like ASAP." I was like, "Okay, thank you very much." Like you said, didn't really go back.
Okay, so let me be clear: ND naturopathic doctor or MD medical doctor?
It was a naturopathic doctor.
Yes, it was.
Okay.
ND.
Okay, so I have
What's
to
the
tread
story
lightly.
With this?
This is a very delicate thing.
Yes.
The key thing that everyone needs to know is that an MD has to, by their licensure, in order to preserve their licensing and their career, they have to recommend the standard of care.
That's the whole thing.
And mammograms are the standard of care, and the mammography industry pays millions and millions, if not billions of dollars every year to politicians and doctors and hospitals and who knows the powers to be to protect their interest. And that's why they're not going to go away anytime soon. And that's why they've become a screening device rather than just a surgical assistance device.
But an ND.
Here's the thing. Okay, so I'm going to tie that in with the ND.
Yeah.
So a lot of NDs work in affiliation with MDs. Okay. Meaning an MD, if they run into trouble and they can't, patient needs care that is out of their realm, or the patient wants more natural care, they'll work in concert, in harmony with a naturopathic doctor.
Okay.
So the MD will refer to the ND.
Okay.
So now the ND is obligated to refer the standard of care because they want to keep the MD.
That.
They want to keep the relationship intact. It's really,
isn't that interesting?
The hands are tied kind of thing.
Does that happen a lot? Or
yeah.
It does?
We have MDs who really believe in thermography. They cannot tell their patients about thermography unless the patient asks for an alternative to mammograms, unless they decline the mammogram and say, "Sorry, nope, not going to let you crush and radiate my breast."
Yeah.
What we call our breast friends.
Right. Yeah. That's good. Yeah.
Yes, I love it.
Nope, not going to let you do that. Is there any other way? And the ones who believe in it, Christiane Northrup, Christine Horner, some of the gynecologists and Dr. Diane Hoppe in San Diego, they believe in thermography, but they have to recommend a mammogram.
It's just otherwise their license is at stake, and
they can. Here's the thing: if they do not recommend a mammogram and a patient develops breast cancer and it's discovered, and they didn't recommend a mammogram, they can actually sue that doctor, and they could take that doctor's license away and put them out of business.
There was a
That's
doctor
how critical.
that we were talking about, a former anesthesiologist, and he was saying to us that all that really matters when they ask him if something happens to his patient, a former anesthesiologist, were you practicing the standard of care? And if the patient died, that's all that matters.
Oh, well.
All that matters. And so the standard of care, I mean, who is that being decided by? I mean, that's a whole nother show, but
that is a whole other
That's a whole other show.
That's like five
other
lifetime
shows.
That's 5 other shows.
Yeah. But so, yeah, very fascinating. So even if you're going to an ND, that's probably why.
I was shocked. I mean, I really was. Just from what I know, I was like, that doesn't seem...
yeah, because that patient could be tied to an MD that was referred to that ND.
And maybe that medical doctor sends the naturopathic doctor a lot of business, and so the naturopathic
Never
doctor
know.
Very
feels obligated.
And vice versa. So the other element is a lot of NDs are also walking that fine line of preventive and allopathic. There's a natural allopathy.
Well, you're saying a lot of
NDs, naturopathic doctors, are also treating symptoms and managing disease because the patient's coming to them already symptomatic and ridden with disease. So they still have to treat symptomatically and the disease while trying to restore and replenish the immune system.
So now, if someone's listening to this all over the country, are there different things that they need to look out for in terms of thermography locations or technology?
That's a great question.
Yeah, someone could be listening. I mean, we have listeners all over the world, so they could
Is
be.
a thermographer the same? I mean, are you? What should you
do
be
they
on the lookout
contact you, or are there places in their area? How does it all work?
They can contact me if they're looking for a referral.
Okay.
To other locations. We have a professional association. We belong to the Institute for the Advancement of Medical Thermology, and they have find someone in your area.
So there's a website, and you can And so based on their recommendations, they're credible, and then they're all that.
They have to be. I mean, there's a lot at stake here. This is medical imaging, so there isn't anyone. I don't think there's any willy-nilly folks out there. There are some people we don't like their style. We don't. Some people have their ethics aren't quite where we'd like it to be because some people will take on thermography as a way to drive business. And so you just have to be careful about that because there's an objectivity element. And that's one of the things when I got into this, I came to this again as a patient. So a very different angle or tact or entry point, if you will. Some people are applying for a job or they happen to be working in a wellness center and they say, how would you like to be our thermographer? We'll pay for your certification and so forth. I came to it as a patient, so I did a lot of due diligence. I wasn't real crazy about how my thermographer was doing things, and I really wanted the best in the industry. So I called every thermographer that I could find this was in 2008. And asked them what camera if they could do anything different, what camera would they have, what reading service would they use, and specifically the thermologist, the reading physician, what professional association would they align with, and where would they get their training. And so I chose the best of all those things in the industry. I was not looking to save money on a camera. My camera's probably costs 5 times more than most cameras in the industry. So you want to look for someone who's, and we're objective. I'm not a practitioner. I am a health consultant. So when people get the results, I can certainly give them some guidance, but I don't give advice and I don't prescribe. I tend to be more of a resource and a conduit for putting them together with a naturopathic doctor or a nutritionist or fitness, someone for whatever their needs are. Someone who, if they have thyroid issues, I'll refer them to a thyroid specialist and so forth.
You spend a lot of time with, rumor has it, you spend a lot of time with your patients.
We do a lot of hand holding. Thank you. I take a very educational approach because, and I found this, of course, and I'm sure this would resonate for you, is that why you're doing what you're doing is that an educated patient is an empowered patient. And they're going to make better decisions, better choices, get better results, and be under proceduralized, we'll say.
Do you see anyone via Skype? Can someone get a thermography in New York and call you up and say, hey, what is it? What do you think about this?
They could. They could, yeah.
I just thought of that. It might be because someone might really resonate with you in particular, and
want to consult based on.
Yeah, I can't do the imaging via Skype, but I can certainly review their results if someone else does it.
That's 2030.
Here's the thing you got to be careful of: is it's just like any other service. If someone's doing the imaging and they're doing the interpretation and they're doing the treatment, that's a little close. That could be a little close for comfort. That's kind of
you want to separate
conflict. It could be a conflict of interest, meaning that things can be manipulated, and there could be. I don't want to suggest that. I would say probably 98 to 99% of the people out there are not of
but
that
it's possible.
mindset, but there's always the temptation or the danger of that.
Okay.
So you just have to be careful of that. We do the imaging. That's it. I do what I call a translation of the results. I don't do the interpretation. I have he's an MD he's brilliant. He owns a saliva testing lab. He's got an integrative practice. He got trained as a naturopath because he fell out of love with the patching and throwing pharmaceutical drugs at people business. He was actually originally trained as a flight surgeon 35 plus years ago.
Oh, wow.
And he teaches other doctors how to become thermologists.
Is he in the area here?
He's actually in Portland.
Oh, Portland. Okay.
See, the reading services, and especially the one that I use, Physicians Insight, they've got reading physicians all over the world.
I see.
Singapore, Germany, Australia, last I heard. So, I mean, it's all virtual because everything is digital.
Yeah, once the image is taken.
We take the images, I upload them to a secured site, the reading service assigns them to my reading physician, and then they drop them back in the box when he's done.
Very interesting. So if someone's listening to this, it would probably be a good idea to have this sort of done because we do like a once a year blood work and things like that.
Part of your annual physical.
So you would do this, people could do this once a year?
Sure. I mean, why wouldn't you want to see things before they become disease or cancer?
I know, right?
Right? And
prevention's the name of the game.
It's totally.
Well,
you think
easy.
about it, a lot of people think, organic food's expensive, right? What's the cost of disease?
Right.
Well, and it's not just, even in people, my insurance will, no. We have a friend who had a liver transplant, and how much, what was the bill he got? $1.3 million.
For a liver transplant?
Liver transplant. That's the part that the insurance didn't cover.
Oh.
So,
that's the part they didn't cover. So I wonder what the total was.
And he had to replace his liver. So you could lose body parts, right? And we're talking about mastectomies. So the cost of disease is much more than the money. Everyone is so dependent on the insurance company. They think the insurance company cares about them. They care about their shareholders.
Yeah,
they care about saving money. They don't want to have to cover any of your expenses.
Yeah. So
you got to put it all into perspective. They don't know you. You're
a number.
You're out there in the world. You're so the thing is that it's all on you. No one's going to care about your health more than you do.
Mm-hmm.
And certainly not the insurance companies. And you've got to think of all the costs of disease. You've got to, I can't tell you how traumatic, it is to go through a mastectomy. I've had enough patients where I caught them after. Unfortunately, they would come to me after they'd had them. And some suicidal.
Really?
It's like, this is what we identify ourselves as women.
And then they're getting their breasts reconstructed, and that's more surgery.
Well,
that's a whole other issue.
I have one practitioner in San Diego who's had 9 reconstructions on one breast.
Oh, man.
She had one mastectomy and has had 9 reconstructions. They can't get it right. And
wow, that's
not to mention, I'm sure that involves foreign.
Here's the other thing that you've got to realize.
Material.
Oh, right.
They always give women the impression that their fake breast is going to be better than their real breast. Really?
Right.
Yeah.
I'm sorry. Nature is always the better choice. And one woman that I talked to about who had a double mastectomy, she said, Lisa, the thing I miss the most is the nipple stimulation during making love with my husband.
Uh-huh.
No one ever thought about that.
All gone.
That didn't even come to mind. It's because you're in such fear, your brain's racing and you're in survival and you just don't think about what will be lost. And
what if a woman has had a breast implant? Can they get this done?
Well, absolutely. It's actually safer for implants. I mean, the worst thing you can do is compress an implant because you can rupture it.
Oh, gosh.
Okay.
Yeah.
Right?
Yeah.
Well, and sometimes they go, oh, yeah, that's no problem. They separate your breast tissue from the implant and only compress the breast tissue. I'm like, what? I mean, there are women that have adhesions. Oh my God, that is terrible.
Yeah.
It's excruciating for some women to try and pull the implant away from the breast tissue. But here's the thing that they don't tell a lot of women. They lead women to believe that they are all candidates for reconstruction.
Do they?
And they aren't necessarily. They don't know until they've done the surgery and removed all the tissue, and they could find, sorry, there's not enough tissue left to our skin or healthy tissue or healthy skin left to do a proper reconstruction. And this woman's been told all along and reassured, don't worry, and we're going to match them up. And that's the other reason they'll do a double mastectomy. They will give up a perfectly healthy breast, so they'll match.
Isn't that crazy?
But plastic surgery, they can match it up. They can match the size and the shape, and it's
so sad. It's so sad.
I think I just get sad more than anything. I mean, it makes you kind of feel angry, but then I just get
especially when the Breast Cancer Awareness Month comes around. Was that every October?
Every October.
Yeah.
We're trying to change it to Breast Health Awareness Month.
Yes.
You know what? Yes.
That's our movement that we're a part of, is Breast Health Awareness. Why do we want to focus on breast cancer awareness? Wait, we're already aware of breast cancer.
Thing is, what's more awareness going to do?
Focus on what you don't want, and you get more of it. You get more of whatever you focus on. So why would you focus on what you don't want?
And especially like
breast cancer.
People looking for something wrong with their bodies and always being
always in fear.
Always in fear.
I mean, that's the sad thing, is that we are afraid. They have made women afraid of their breasts.
Mm-hmm.
Now, that fear energy is probably one of the most toxic, acidic energies you can send anywhere into the human body, especially the human breast tissue.
Yeah.
So now we're afraid of our breasts are not this beautiful thing that makes us a woman, but it's something to be afraid of that could kill us. Now they're cancer receptacles.
Mm-hmm. Yeah. Mm-hmm. Yeah.
That's what's crazy. And that's what's so sad about the Angelina Jolie. And I really respect and appreciate why she made the decision, and sadly out of ignorance, because she can only do make a decision with what she had to make that decision with. She had missing information. And that's why you're doing what you're doing, and I have such respect for what you two are doing. Thank you so much for inviting me to do this.
Oh, yeah. Well, it makes me sad
we
because
can save more women from...
I find it very strange in 2014 when she had it done that all this stuff is just a type away in Google. I mean, how could she have not seen? I mean, thermography, I mean, someone of her caliber and with her information and people she's surrounded with, someone must have mentioned that word.
You never know what's backing that decision to go the regular route, though, either.
You don't. Yeah.
Poster child for.
Yeah.
Wow. So
if their mindset or their upbringing or, who they're affiliated with or, what's going on in the background, you just can't know.
Mm-hmm.
Wow. So people can get in contact with you, discoveryscreening.com. And so would people need to get in contact with you if they're local or if they're, I guess if they're all over the nation or world, I don't know if you could help them, but maybe they could seek out help.
If they can't find someone locally,
you can help them.
Happy to have them call me. We're at 760-436-8811.
DiscoveryScreening.com.
Discovery Screening.
And you're headed up to Dr. Bergman's today?
I am. We're going to do some fancy imaging of some of my patients.
Have you ever been to one of his health talks?
Oh, ever. I've been one of his health talks.
Yeah, have you?
Yeah.
How fun.
He's especially in October, he always has me come and do a thermography versus mammography and breast cancer talk.
How fun.
On preventing and that's the key is knowing what can cause breast cancer and what can prevent it. And early detection is also a misnomer, because we're not wanting to detect cancer early. We're wanting to detect and prevent. We're wanting to find the earliest indicators that something's up before it becomes cancer. Mm-hmm. So it's early prevention rather than early detection.
And it's really management, because we all have cancer cells in us all the time.
Mm-hmm.
It's just a matter of managing that and making sure that
what to do with them.
The cancer stem cells do what they do, and then they get flushed out, and so it's not letting it grow. And so prevention, I wish this kind of stuff were taught to teenage girls in schools, where they could taught not to put your cell phone here, not to wear tight bras, and all these just simple things.
Yeah. Well, the earliest breast cancer diagnosis was 11-year-old in San Diego, of all places.
How long ago was this?
Oh, this was a few years ago.
11 years old?
11 years old.
Was it really cancer?
It was breast cancer.
Oh, my God.
Well, and you think about it, if breast cancer, or most cancers, can take 8 to 10 years to be large enough to be seen, she may have started developing it at birth, and it could have been from chemical toxicity, heavy metal poisoning. Who knows what she could have been exposed to. It could have been something the mother was exposed to in vitro.
And then when the
she got it in
hormones
vitro.
Start going at puberty, and then it just goes to the weakest spot.
There you go.
Well, you think about all the non-breastfed babies too, with all the formulas. I'm sure there's estrogenic.
They get everything.
Soy and everything.
Yeah,
that's true.
There could be
they say every baby is born with at least 80 to 100 chemicals in them now already.
And I heard there's something
in the
like
umbilical cord, right?
200, over 200 chemicals.
Is it over 200? It's
up there.
It keeps going up.
Yeah,
as
right.
if it's 199 is any different,
right?
Yeah, and the mother's milk is huge. Whatever the mother consumes, the baby consumes.
I promised a girl in the chat room we'd ask a quick question she had for you before we wrap up. Is that all right?
Yeah.
She wants to know your take on how powerful is self-massage and skin brushing to cleanse the lymphatic system? Is that super duper important?
Super duper important.
Yeah. Do you suggest that to people who are having
I suggest that to all my patients, and especially the ones where we see lymphatic congestion as a result of their thermography, because we will actually see the inflammation where the lymphatics are congested. Sure, because that's going to upset the tissue in the area. There's just no denying that. And so there is one of my favorite websites you all love. It's breasthealthproject.com, and they deserve the PR, the exposure, breast health, HEALTH project.com.
Okay.
And on that site, you'll see breast health 101 in the menu bar. And the first thing in the drop-down menu is lymphatic breast massage.
Okay.
It's a 5.5 minute video. It's 4 maneuvers that it takes 3 minutes a day to do. And the woman who told me about it had the clearest breasts I'd ever seen. And that's how I found out about it. I said, "What are you doing?" Because I want to tell my other patients to do what you're doing. And she had been doing this for 3 minutes every day just before getting in the shower for 3 years. And her breasts were completely clear and have been since I've been imaging her. And so this is one of the best things you do. Dry brushing, especially in the axilla, real light, almost as light as a tickle. Because remember, the lymphatic system is triggered by the sympathetic nervous system. So you don't need, dry brushing is more like exfoliating, but lymphatic brushing is almost like a tickle. So you want to do it so light that it's like a tickle.
Okay.
Is that why you're sort of talking about like the health bounce, where you just sort of
yes,
you barely jump?
Just the jumping is a gentle massage of the lymphatic system.
So
you don't need a real hard lymph.
Where do you do that brushing so light, sort of underneath the armpits?
Well, it's from under the, even with the breast, from under the arm and across and on a diagonal across the top side of the breast. So from about 3 o'clock of, let's say if we're looking at the left breast, you're starting about 3 o'clock. If you look at an analog clock on the breast is a clock. Okay. Then from 3 o'clock, and you're going to come diagonal 3, 2, 1, 2, and then pull the brush away at about 12 o'clock. So just a real light, almost a tickle.
Okay.
And then from the other side on the right, from 9
day.
O'clock to 12.
That isn't easy.
Right before the shower. I mean, really easy.
Yeah.
Right.
Oh, it's really easy to do. And again, the lymphatic system plays a huge role in our overall health and, carrying waste out of the body and also delivering nutrients.
So when you're talking with someone who gets a scan, is this all news to them?
A lot of them. Yeah.
Mm-hmm. Yeah.
So again, a lot of this is actually covered throughout their experience with us.
Okay, so they come in and
from the moment they make the inquiry, we answer a lot of these same questions throughout the imaging process, and then when we go over their results with them.
It's almost like a broken record, but it needs to be played.
Mm-hmm. Oh my goodness! There's so little understood about the human immune system. Is the greatest gift we've ever been given, and it's in our bodies. I mean, it's the most phenomenal, most complex, intelligent system in the physical form on the planet, and it's in our bodies. And we give very little attention and credence to it and credit.
Don't even think about it.
We don't think about it. We don't think about protecting it because its job is to protect us. And if we just overload it, and we're literally snuffing it out, we're literally annihilating, again, our own defense system.
It's like having a deep respect for that part of our body. We talk a lot about on this show is our DNA and our genetics is a gift, and it's something that we need to hold with reverence and respect, and passing that gift in the best, most healthy way possible down to our next generation. But people don't realize that the food they're eating now is changing and altering their genetics and their biochemistry and their physiology.
Especially if it's GMO, absolutely.
And even though, people think, I'll eat well during pregnancy, but the food you eat your whole life makes up your physiology.
It's cumulative.
And it passes to generations.
It's going to be in your system when you reach pregnancy, and it's all going to play a role, especially heavy metals, if you have amalgam fillings, if you have tooth infections, if you have digestive issues, plaque in your intestines. Nobody thinks about that plaque. Again, I was telling you, it's like tar. That is putrefied dead matter. Who knows how many years or decades that's been there. And that is leaching through your intestinal walls into your bloodstream. So it's toxifying you 24/7. But the other side of that is that it's also blocking absorption on the inside of your nutrients. So you've got a double whammy there. You've got the toxicity that's toxifying you 24/7. You've got the blocking of the nutrients, and we absorb 80% of our water through our intestinal walls. So you could drink a gallon of water a day and still be dehydrated. And dehydration can kill you.
Yeah.
People are still dying of tooth infections, but they're not calling it a tooth infection. They're calling it a heart attack. They're calling it breast cancer. They're calling it lung cancer. All these cancers, again, are not the problem. The cancer isn't what's killing the person.
Yeah.
My dad had lung cancer. He was emaciated. He starved himself to death. He ate bad food. Wow. He drank it's like he was poisoned to death. He was doing, frozen dinners.
Microwave.
Oh, and microwaving them. You've microwaved everything. It's, so it's like, you've got to realize that you've got to keep your digestive. That's the system that's where our nutrients go in through that system, and you've got to keep it squeaky clean.
So thermography.
I will never
really
do a colonoscopy. I'm going to tell you that right now.
Yeah,
those things are dangerous. They can perforate you, and you can die of a perforation, especially if there's plaque in your gut. Think of the toxicity of that getting into the abdominal cavity. So they're never going to find anything, because I'm not going to be growing polyps or diverticuli and mushroom pockets from compaction of dead matter. And nobody realizes too that, and this could be another show, you guys.
Yeah, I know, right?
That carnivores have 30 times the hydrochloric acid than we do. 30 times, and they have 1/5 the length of their intestines. So when they eat meat, they liquefy it in their stomachs. They get the nutrients out of it, and they get it the heck out of their system. We have the tooth structure, the digestive structure of herbivores. We're adapters. And in the paleo times, I don't want to get too sensitive here, because I know a lot of people are in that. We were survivors. So we were eating whatever we could get our hands on. We didn't have the agriculture then that we have today. But that meat, dairy, and eggs takes a long time to digest, and it's very hard to break down. What makes the milk difficult to break down is the one thing that only a baby cow can digest, and that's the casein. And that's the thing that makes the milk white. So you can take out all the lactose, you can take out the sugar, the fat, whatever, but it's what makes it white is the thing that's hardest to break it down. That's the casein.
Wow.
And that is what turns to the plaque and the tar and the gook and the crud that coats the walls of our intestines.
Yeah, we ate that for how long?
Yeah. Well, the reason I was laughing earlier when Lisa was talking about that is because you and I, we joke, but we're like, hey, we probably still have bits of our 3-year-old birthday party cake in our intestines.
Yeah,
and these
the mac and cheese we ate in 4th grade.
These things have been known to come out little blue toys, in the toilet. When they're doing their coffee enema during their intestinal cleanse.
Fascinating.
So these are, just critical things for prevention. And bringing it back. Thank you so much, you guys, for your commitment, because I know what a commitment it is to do what you're doing. It's huge, and you're making just a precious contribution to the planet, helping it to heal and helping to educate people again, because education is what empowers people.
Thank you for doing what you're doing.
Thank you for inviting me.
Yeah, my goodness.
For believing in what I do. If it wasn't the thing that helps to find things early, I wouldn't be doing it.
Yeah.
You know?
Oh, yeah.
None of the others would be an option. It's
you're saving lives.
Because we are saving breasts and we are saving lives. And we don't, I almost wish we knew what we were preventing, so we could at least say, well, we prevented this person from losing a kidney.
I know, right?
Right.
You know, we can know maybe we prevented someone from having to have a mastectomy or a lumpectomy or whatever.
Yeah.
But you know, you don't know if you prevented a heart attack or a stroke, except that, you know, if you find the reduced heart function or the inflammation in the carotid artery, they may have died of a stroke, you know. So it's very gratifying. And
the joy probably comes in seeing the transformation process in your patients and seeing people actually make life changes.
Seeing the light go on.
Yeah, light go on, and then all of a sudden the next time you see them, they're healthy, and that's got to be really
their energy
gratifying.
back, and so
good stuff.
Well,
thank you. Thank you guys for stopping by on your way up to Dr. Bergman's. We appreciate it so much.
Well, I want to, my illustrious and amazing husband wasn't on the air with us, but Attila, my hun, Attila Tota, is my partner in the business, and he runs the business side of things. So very much like you two, we're two peas in a pod, and
that's awesome.
very complimentary, just very passionate about what we do and working together to make it happen.
And that helps too.
It does.
Being
it's
happy
nice to have a partner.
and being fulfilled in your work.
Being fulfilled in your relationship and your work. And it's an outpouring into the community. And so we just love blessing our community with what we're doing, just like you two are doing.
Yeah,
I can tell.
Definitely.
Blessing your community. So thank you.
You're so welcome. DiscoveryScreening.com if you guys are interested in learning more about Lisa's website and what they're up to. And people can, if they're in the area, they can go and visit your physical location, but they can also see you at Dr. Bergman's. Is that correct?
Oh, well, we are a mobile service. So we actually don't do imaging in our offices. We do the imaging at all our hosting clinics. And we have 16 hosting clinics that
I didn't know that.
Some have an assigned day of the month, like the second Tuesday, the first and third Friday is Bergman, second and fourth Friday we're in Encinitas, Vista, Point Loma, we're all over the San Diego area, and then Huntington Beach.
So if people want to find out, do you have a Facebook or a newsletter where they can be updated on where you're going to be?
So if they just come to our website, they can sign up or send an email to info@discoveryscreening.com.
Okay.
And we'll put them on our list for updates and
they'll be
newsletter.
notified.
Like, where's Waldo?
Yeah.
Where's Lisa?
I know. Where's Lisa? It should be a map.
Where in the world is Lisa?
Where in the world is Lisa?
Some of our clinics are on an as-needed basis, so they'll see all the locations on there, and it's just a matter of putting enough people together, and we go out and do the imaging.
That's a really neat way to work, I think, just to not show up at the same 9 to 5 office every day, getting bored.
Makes it so much more stimulating and interesting.
Yeah.
We meet all the different communities. We, like yourselves, we get to, I was saying that when we first got here, so we meet the coolest people because they're all about,
we do too.
Making changes and making a difference and, healing the planet.
So fun. Yeah, it's so great.
Fun.
It's great to empower people, and that's what we're all doing. You have an amazing website, too.
Thanks.
Yeah, it looks really great. It's visually, it's just great. Yeah,
thank
I like
you.
it.
We just had it rebuilt.
Yeah.
Yeah, so there's lots of good information on that.
I love it. Okay, DiscoveryScreening.com. I want to thank everyone for joining us in the chat room. We appreciate it so much. That is extremehealthradio.com/live, and we broadcast there every Friday morning at 9 a.m. Pacific, and there's usually lots of people in the chat room, and you can make some friends. And you can even chat after the show's over anytime you want. If there's people in there, you can make some friends, and we appreciate that. Let me see who our guest is. Actually, we're going to be having a guest on Monday. I should let everyone know. For the next 4 Mondays, we're going to be having guests instead of our normal Friday show. So we had some of these people scheduled prior to this, and they couldn't change their schedule. So there's a little bit of a mix-up. But on Monday, we have Dr. Gary Gordon. And we're going to be, I'm not sure what we're talking about. It was something very scientific.
Oh, something I've never heard about before, which always fascinates
me. Not the best teaser of a show, but Dr. Gary Gordon, look him up, though. He's an amazing guy.
We have him Monday, and I will not be around for that show. I will be out of town on a retreat, but you will hold down the fort. Wednesday, we have a special edition show, 11 a.m. Pacific, our time.
Oh, okay.
Andrea James will be in, and we're kind of going a little bit off the health topic and talking about her former criminal law practice that actually ended her in jail, and she wants to talk about her story, and she's written a book about rights as women and mothers in the penal system and what needs to be overhauled.
I love it.
And also we have a Thursday show.
My goodness.
With our friend Mary that's going to come in for a special 10 o'clock show this Thursday, 10 o'clock. So we have 3 this coming
week. We have our work cut out for us this week.
Right.
All right. So thank you, everyone. Make sure to check those shows out. Follow us on Facebook, and we'll put links out to those shows that come up so that you can stay in tune and up to date with everything we have going on. And thank you so much, everyone in the chat room. We really appreciate it. It's so much more fun when you guys are in the chat room. I love it. So appreciate it so much, and we'll catch you on Monday morning. What date is that? It's going to be the 9th?
Yep.
March 9th at 9 a.m. Pacific time. So we appreciate it so much.
Have a great weekend.
And we'll catch you on the next episode. We just had an awesome show there. Lisa Kalison from DiscoveryScreening.com. Kate and I should say, have a ton to talk about right after this. We're going to take a little bit of a break right now, talk about some rebounding, which we talked about during the show. And I would highly suggest you get into the rebounding. We do it every single day. The Bellicon is just amazing. So we're going to run a little ad for that, and we're going to be right back, and we got a lot to share right after this break. I have been a huge fan of rebounding for many, many years, and if you want to get in great cardiovascular shape, tone your legs, back, and butt, and stomach, as well as cleanse your lymphatic system from toxins and chemicals, you just have to start rebounding. It's imperative. And not only will it create endorphins that quickly become addictive to you, but it's very low impact as well. It helps to prevent sicknesses and diseases, as well as increase bone density, and it flushes toxins from your lymphatic system. It's amazing. And not only that, but it's a ton of fun also. I do it every single day for about 15 minutes. And we found the best rebounder on the market today in the world, bar none. It's called the Bellicon Rebounder. It's the Rolls-Royce of rebounders, in my opinion. And let's listen to some of what our guests have had to say about rebounding. Robert von Sarbacher is a health researcher and creator of the Mini Beat Protocol. And Robert, what's your favorite exercise?
In general, probably one of the number one anti-aging exercises on the planet is rebounding. So 15 minutes a day is good for that. You can find people who have had thermography scans on cancers, giant tumors, and when they're doing a rebounder, it would start spewing out and shrinking right in front of your eyes, the tumor would, as they're on the rebounder. So it's really good for that sort of thing. It's also very good for exercising internal organs. It's the only internal organ exerciser that I know of known to man.
Dr. Lindsay Duncan is the CEO and founder of Genesis Today. And what's the best way that you think of to stimulate the lymphatic system of the body?
Rebounding is incredible because it's good for the lymphatic system, and there's more lymph fluid in the body than there is blood. And the quickest way and the most effective way to get the lymphatic system flowing is through rebounding itself.
Yeah, because the lymphatic system can't really detox itself, can it? I think you know.
No, the heart, we have the heart, thank you, for pumping blood. And we don't have a heart to pump lymphatic fluid. The only thing that really can pump lymphatic fluid is cardiovascular exercise utilizing the thighs, the thigh muscles. And that's why rebounding and getting a burn in that thigh muscle is so important for the flow and the stimulation of the lymphatic fluid.
Wow, and they even put cancer patients on rebounding, don't they?
Nutritionists do.
Yeah.
Yeah, absolutely.
Yeah, but not a conventional doctor. But yeah, I've been learning about rebounding lately. It's quite an amazing thing.
Yeah, rebounding's amazing.
Health researcher and author of Cancer Step Outside the Box, Ty Bollinger. What do you do in your life to prevent cancer?
What do you do to treat cancer? What do you do to prevent it? Rebounding is something that I try to do on a daily basis. A little mini trampoline for those people that aren't familiar with the term rebounding, but it's basically just jumping up and down on that little mini tramp. What that does is it stimulates the lymphatic system. Lymphatic system is one of our primary detoxification systems in our body. And most folks don't stimulate their lymph flow, and so the toxicity in their body builds up because their lymph is not stimulated. And the up-down motion on a rebounder stimulates the lymph flow better than just about any other exercise. So I do that almost on a daily, probably 5 days a week. I would say I average doing that.
And finally, author and speaker and creator of the Longevity Now program, David Wolf. Do you think the Bellicon is the best rebounder on the market today?
Absolutely. I was just with the crew in Europe that does the Bellicon rebounder, which is an incredible rebounder. My God, what a machine.
Mm-hmm.
And it doesn't use metal springs. It uses like flexi ropes. So it's very soft and fun, and it's just great to play with.
Well, there you have it. The up and down G-force actually stimulates every single cell in your body. It's incredible. And as someone who works out in the gym a lot and does Qigong, I think that the best physical aerobic exercise, in my opinion, is rebounding. It's just absolutely incredible for the human body. And the Bellicon is silent, and it comes with a warranty, and you can get them in several different sizes and colors, and some of them have bars that you can hold on to in case you're worried about balance. It's a well worth it investment in your health and in your future. So check them out in our store if you'd like, or you can check out the videos on extremehealthradio.com/Bellicon. Again, that's extremehealthradio.com/Bellicon. That's B as in boy, ELLICON.
All free shows, all the time, on Extreme Health Radio. Opening minds and transforming lives worldwide. Join our community today. Sign up to our email list and instantly get our free gift to you, along with loads of inspirational content and cutting-edge tips to help change your life at extremehealthradio.com/subscribe.
Well, who's ready to run right out and get a mammogram?
My hands waving desperately in the air, wildly.
Waving in the sky.
My gosh.
Yeah, crazy, huh?
Yeah.
Who would have known all that stuff going on with mammograms?
I have to say that I am very happy that I haven't been talked into one yet, that I have gone against the advice of a couple people that have thought that was a good idea for me after hearing all this.
Yeah, crazy that 2 naturopathic doctors recommended that. That's really amazing and fascinating.
Right?
But you know, it makes a lot of sense that they do because they're tied to the MDs, like she was saying.
When she explained it like that, it made a little bit more sense. But
yeah,
I know. Isn't that kind of creepy?
What did you think when that naturopathic doctor recommended that for you? You just couldn't. It's like a.
It was a disconnect.
It was a complete disconnect, wasn't it?
Yeah. I mean, the last time that had happened was walking out of... I actually blogged about this. It was very upsetting when I walked out of my last OBGYN appointment a year ago because I went in for some very specific things to deal with this fibroid issue I've been having. And, while they do their breast exam and stuff, I said, by the way, I have this little thing that I believe is a cyst. Told her all about, the ultrasounds I had and everything. And she just immediately... It was very disconcerting to her, and she goes, "Well, anytime anything pops up, we'll go get a mammogram." And I'm like, "We'll go get a mammogram."
Yeah, we.
I'm not going anywhere near that place. So, yeah, surprising. It always surprises me when you walk away feeling disempowered by people that you really kind of think are more on your side.
Yeah, especially when you go and you're aligned, like you said, with a naturopathic doctor, and then they tell you something is complete disconnect.
Mm-hmm. You're seeking them out for them to say. There's other ways. I mean, the fact that she didn't even say, have you heard of thermal imaging? Or there are other ways to, is she misinformed or she doesn't know or she's getting a kickback? Like, who knows?
So she didn't mention thermography at all?
Oh, no. No. And it's so funny.
It wasn't like you can do these 2 things, but it was just only mammogram?
No, here's a prescription or a slip to go march over to the x-ray place and the imaging center and get a mammogram or the mammogram place, whatever that is.
Wow.
Yeah. Isn't that insane?
That is crazy.
Yeah, I said no, thank you very much, and actually threw that away, and it was pretty disheartening. But that's why you just have to be so on your own. Like you have to fight for your own health, and you have to pick your team. Like I always say that with Lissa Rankin. She talks about having your team of people around you. I'm totally blanking on what she calls it, but it's like your round table.
Oh, your round table.
Yeah, and if people aren't playing on your round table the right way, then bye-bye.
Yeah, I know. It's almost like you get to pick who's in your round table, and you just kick them out.
You do, and you're hiring them, and you can fire them just as, just the same. But I think for me it was discouraging because not only did she not mention that, I'm sure she had heard about it throughout the years, but didn't even give it as a possibility for me, and I'm sure other women. But yeah, it was the same with the fibroid issue. I said, well, how do people go about shrinking these naturally? Because I'd already done my research and thought that she'd mentioned the same things and at least put it all together and make some sense of it. But no, she said, well, I don't, why would you not want to do surgery? And I thought, that's an odd answer from a more holistically minded practitioner. And so when we kind of threw that around and I said, I have no desire to do that, what are some other things? And she said, well, acupuncture is kind of known to help. So maybe, try that. And I just walk out feeling, I had a whole blog post on feeling really disempowered by that conversation and that appointment. And I spent a lot of money on that. And
do you think it's something where people feel like they need to get an ally? Like, how much credibility and stock do we really need to put into even a homeopathic doctor? Because you and I have been learning the last couple of years with your health challenges that you don't, everyone who talks to you, even in the naturopathic field, it's just an opinion themselves.
Just another voice, like we say. And unfortunately, I value some voices more than others, but when it comes down to it, you are the only one that is going to care about yourself as much as you do. And I think there's something about getting still and really listening to that internal voice. And I think that is a challenge, and it's easier said than done. But I think having a few people around you that you trust and really see eye to eye on things helps out. But you are ultimately the one that's going to have the answers and know what to do. And it's pretty wild. It's a wild, wild journey when you realize how much responsibility is placed on ourselves for ourselves.
Oh, man. Yeah, totally. Have you heard of the thing, the blind man and the elephant?
Maybe. They walk into a bar.
A blind man and an elephant walks into a bar.
Where's the priest?
Where's the priest? Where's the Catholic nun?
They walk into an oxygen bar. Okay, got that.
No, but it reminds me a lot of this thing because you have a naturopathic doctor.
Did you say where's the blind man?
No.
Oh, I thought you. What did you say at the end?
I said it reminds me a lot of this thing.
Oh, that's funny. Okay.
And so here it goes. It's so basically there's I'll just read it. It says, once upon a time there lived 6 blind men in a village. One day the villagers told them, hey, there's an elephant in the village today. They had no idea what an elephant was since they were blind, so they decided, quote, even though we would not be able to see it, let us go and feel it. All of them went where the elephant was. Every one of them touched the elephant. So the first guy says, hey, the elephant is a pillar, said the first man who touched his leg. Oh, no, it's like a rope, said the second man who touched his tail. Oh, no, it's like a thick branch of a tree, said the third man who touched the trunk of an elephant. It's like a big hand fan, said the fourth man who touched the ear of the elephant. It's like a huge wall, said the fifth man who touched the belly of the elephant. It's like a solid rope, said the sixth man who touched the tusk of the elephant. They began to argue about the elephant, and every one of them insisted that he was right. It looked like they were all getting agitated. A wise man was passing by when he saw this, and he stopped and asked them, what's the matter? And they said, we cannot agree upon what the elephant is like. So each one of them told what he thought the elephant was like. The wise man calmly explained to them, all of you are right. The reason why every one of you is telling differently is because each of you touched a different part of the elephant. So actually the elephant has all of the features that you said.
I read that last week for the first time.
Did you really?
Did you see it on Facebook?
No.
Oh. Wow. We are the universal mind.
Yeah. So I feel like this is what's going on with our health, because you have one guy says this, another guy says that, and they're all just opinions of...
And they could all be right.
They could all be right.
Right.
Yeah.
That's a great illustration of
so
how
when
I
you
feel
go to
about
a
this
natural
health journey.
What's that?
Oh, that's just a great illustration of how I feel about this health journey. But
I know.
What were you saying?
No, just when you go to a naturopathic doctor, they too are only giving you their opinion about something because no one really knows the inner workings of how your body's moving and acting and feeling right now.
Completely.
Yeah.
Wow. That was the perfect story to read for that. It's funny. I just read that the other day.
Yeah. So thermography sounds like a really cool thing. It's
I want to do it every year.
No radiation, no breast compression, no pain, no physical contact. The earliest indicators are 8 to 10 years before mammograms that show up before it becomes a cancer disease. Pretty cool. Over 800 research studies on over 300,000 women, some for up to 12 years, and the FDA approved before mammograms were in 1982.
Wow, that was in 82.
Yeah.
Don't you feel like talking to Lisa was like, it just brought to, when you said there's no pain or involved or whatever, but that whole no pain, no gain. It's so anti-Louise Hay style. I read about her, and I was reading this passage in a book recently where I think she co-authored it with a couple other people, but they were talking about going to the grocery store to get stuff to make dinner together. And Louise Hay basically said, like, why should we make our lives harder by carrying around these giant bags? Let's get a cart, throw them in there, and push the cart. Like, why should life be heavy when it doesn't have to be? Like, let's make it as easy as possible at every chance we have an opportunity to lighten our load. But it reminds me of this no pain, no gain thing. It's like, wow, if you could get thermography and understand the reasons behind why it just blows mammograms out of the... I mean, it basically makes me think no one should get a mammogram because they're not offering anything that this thermal imaging is, right?
Yeah.
But I thought, isn't that funny? Like what Lisa was talking about, like these very invasive things. Like you biopsy and there's pain involved. You spread things. You could potentially do some damage if you're going the more painful route, or a surgery. You know, you're building the scar tissue, or it's this painful thing to go through. And I think, isn't that funny that, like, you know, even going and puncturing your skin with a needle to get blood work, you're damaging your body to some extent, and it's painful. But how funny to have something really gentle, like an ultrasound or an image, and an imaging thing where it tells you amazing stuff while you're being kind to your body. Yeah. And I just think, gosh, there's something so beautiful and true about loving and treating yourself with no pain,
right? And
still getting more amazing effects than you would if you were like kind of coming at it and attacking it or hurting it.
Yeah, I remember the bit in Louise Hay's book or something where she was talking about how when everyone, you know, someone looks on I think I mentioned this on the show, when people are looking at their body and doing all these tests, and, you know, they're looking for lumps, they're looking for weird moles. I mean, it's good to be on top of things, but like Louise Hay would do the opposite. Like she would do skin brushing, and she would talk to her body and thank her skin and her leg and her arm that she's doing the skin brushing on. And it's like it's completely a different way of looking at how we look at our body and loving ourselves, and not always looking for something wrong. Because if you look for something wrong, eventually you're going to find it.
Sure.
Yeah.
Yeah.
You know?
Yeah, I agree with you. You don't want to be an ostrich with your head in the sand and ignore things that your body's telling you, because that's its way of communicating to you too. Like Lisa was saying, like when you feel a lump, you know, it hasn't just happened overnight. There's something going on that is causing that. There's good reason to address that. But you said, like, there's two ways to approach it after you have that information.
Oh, yeah, totally.
I'm finding it to be a way better situation for me when I don't freak out about things and run off and do the first thing that someone tells me is the best idea, in their opinion.
So when are you supposed to get one? At 40 and 45, or when's one, or 50?
I think they're recommended now for 40. I think it's 40. Maybe it's 45. I don't remember. I talk to people all the time, and they always say it's time for, you know, it's that time. I always think it's around 40, but, you know, that seems a little young. Maybe it's 50.
But I would probably say that if you're a person who doesn't take care of themselves, if they eat fried fast food and live a stressful lifestyle, doing work they hate, and doing all these stressful endeavors throughout their life, and eating a standard American diet, I wouldn't tell that person not to get a mammogram.
I know, right?
Because, I mean, they're within the realm of possibility of having things go wrong with them. But if you're taking care of yourself, like we are, doing the best we can, and constantly trying to get better, and constantly trying to improve and add more things that we do to how we take care of ourselves and our self-love or whatever.
Yeah.
You know, I think the more you take care of yourself, the less you're going to need other people's tests and screenings and all that kind of stuff.
Other people's services.
An abnormal thermogram is 10 times more significant as a future risk indicator for breast cancer than a first order family history. A persistent abdominal thermogram carries with it 22 times higher risk of future breast cancer.
Oh my
Extensive clinical trials have shown that breast thermography significantly augments the long-term survival rates of its recipients by as much as 61%. When used as a multimodal approach, a clinical exam plus mammography plus thermography, 95% of early stage cancers will be detected.
Oh my gosh.
Yeah. Pretty interesting.
I would like to do it, like you said, maybe once a year along with just a whole panel of blood work just to give it a go. And really, that to me feels right. That feels like a really good indication of where my health sits at that point, you know?
Yeah, totally.
I think
sounds
I need
good.
Thermography in my eye. I just had like a stabbing pain in my left eye. Woo! Like caused me to shut my eye. You know, every once in a while you just get this weird thing and then it's gone.
Yeah, I had that during the show. I had something with Lisa. I had something in my eye. And
you did?
I was realizing I wasn't drinking enough water. I don't think I was hydrated enough.
Oh, interesting. I felt like someone just came at me with a knife.
Or that.
A little different than hydrating.
A little different.
Anywho.
All right. So this was episode 363. I hope you guys enjoyed the show. And we're going to be on, like I said, at the end of last show on Monday with Dr. Gary Gordon, 9 a.m. Pacific at extremehealthradio.com/live. If you have any questions, he is a great naturopathic doctor on the cutting edge of tons of stuff. He's got a whole supplement program he does, and he's into PEMF, which is pulse electronic magnetic radiation or field therapy, something like that. He's really into anti-aging. So if you have any health questions, join that show, 9 a.m. Pacific on Monday.
You're going to be holding down the fort.
Yeah, I'll be holding down the fort. You're going to be basking in the sun.
I am going to be basking in the hills of Montecito, hiking and taking a break.
That's right.
Very excited.
Yeah, and then we have, let's see, this next week, we have a couple other interviews, I think on...
We have Wednesday with Andrea James, and we have, that's at 11 Pacific Standard, and then we have Thursday with Mary Atala.
Is that for sure or possibility?
I'm pretty sure it's as of right now, it's for sure. That's Thursday at 10.
Wow, okay.
So Wednesday at 11.
Okay.
Thursday at 10.
We'll be posting these
I need to get out of town.
Yeah, we'll be posting these to our Facebook followers. So if you haven't followed us on there, follow us on there. And that way you can stay up to date with all of our shows if you're interested in that. That's about it, right?
That's it. That was a lot of fun. Thanks, guys.
All right. Thanks, guys.
And we'll catch you on the next episode.
Hey, everybody. This is Josie, Justin's mum. Don't tell him, but I know he would absolutely be really happy if you would sign up to his free weekly newsletter. And don't forget to share this with all your friends. This is the buzzing bumblebee signing off.
That's so good.
Oh my gosh.
Thank you for listening to this episode.
It's time to go for now, but our mission does not end with this show.
Justin and Kate will be back with another interview packed full of ideas, discoveries, and unique ways to regain your health.
Head on over to extremehealthradio.com/subscribe and instantly download our free gift too that contains cutting-edge strategies to start making healthy lifestyle changes today.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor.